This is the deputy clerk. We are now streaming live on the internet. Thank you very much.
Good afternoon, Dwight.
Good afternoon.
Have a great meeting. Good afternoon, Miguel.
Hi, good afternoon, Rhonda.
Have a great meeting. Good afternoon, Tom.
Good afternoon.
Can hear you loud and clear. Have a great meeting.
And this is my daughter, Megan.
Hello. Good afternoon, Sarah.
Good afternoon.
Have a great meeting.
You too. Thank you.
Good afternoon, Assessor Stone. Good afternoon, James.
Afternoon.
Have a great meeting.
Sorry, we didn't. Mic check. Hello?
Hello, we can hear
Hi.
you.
Wonderful.
Thank you. Good afternoon, President Wasserman.
Good afternoon, Rhonda.
Your clerk today is going to be Colin.
Colin, wonderful. I've got one dilated right eye, but I figure that's better than this for the meeting.
You look like Joe Cool with those glasses.
There we go. If I do that, I can't see the screen at all.
Well, we can't have that.
No.
Good afternoon, Vice President Ellenberg.
Good afternoon, Rhonda.
Have a great meeting.
Thank you.
And you said Jill, right, Rhonda?
No, I said Colin.
Colin, thank you. I had the two L's right. All right. No, there's only one L in Colin.
I wasn't going to argue though.
Blame it on one good eye. All right. Colin.
You were seeing double.
That's right. All right, and I see Supervisor Lee, Vice President Ellenberg, and we're missing two more, and it's 1:30, so we'll start as soon as they show up. Or another minute, I guess we have three. There's one of my favorites, Matthew Fisk. How are you, sir? You're muted, but I'm going to take that as you're doing well, and I'm one of your favorites too.
Thank you very much. Appreciate that.
All right.
Probably, maybe by the time the pandemic's over, I'll figure out how to unmute myself before the meeting.
Hey, we all do it. There's Supervisor Semidian.
Supervisor Chavez has also joined us. It looks like Supervisor Semidian's audio is still connecting, however.
All right.
It does look like he is connected now.
And we have Supervisor Chavez. That makes 5. Vice President Ellenberg, if you'll please lead us. I'm sorry. We need a roll call vote, please. Call it.
Supervisor Lee,
Lee present.
Supervisor Chavez,
Here?
Supervisor Semidian,
Here.
Vice President Ellenberg,
I'm here.
and President Wasserman.
I'm here as well. Thank
We
you
have a
very
quorum.
much. Vice President Ellenberg, if you'll please lead us in the Pledge of Allegiance for all those that can stand and everybody else.
I pledge allegiance to the
Recording in
flag
progress.
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We're now going to move to item number 3, announcements in memoriam. And I have one for today. It's in memoriam of our very own Mary Stevens, Budget Director for the County of Santa Clara, who passed away on May 23rd. It's my understanding that her husband Tom is here and her daughter Megan as well. And I think I just saw them a minute ago before I got spotlighted, but I believe
We are here.
husband Tom. Wonderful. Thank you, Tom. It is therefore fitting that she be honored and memorialized as a part of our budget hearings, a process that she led with equal parts expertise and humility for many years. Mary grew up in Santa Cruz, where she had fond memories of playing outside, long hikes, 4-H, backyard barbecues, Friday night football games, Saturday morning chores, and Sunday morning mass. That's how I grew up too. Mary returned to Santa Cruz after college to follow her heart and to look for a job in public service. She found both. On her birthday in 1981, she married her college friend and later sweetheart, Tom Stevens, who's joined us here today. A few years later, she launched what would become a nearly 30-year public service career with the county. During her tenure, she rose from a staff analyst to the leadership role of county budget director. Mary's long career began before desktop computers. She tackled every job there was in the budget office. She would work late hours and even overnight to develop a solid, high-quality budget every year. The hallmark of Mary's career was putting others first, her staff colleagues, county employees, and the public. She cared deeply that employees were treated fairly and that the budget and budgeting process was transparent and understandable for the public. She was fundamental in rebuilding critical safety net services after years of budget cuts due to her deep level of knowledge and caring about the services the county provides. Mary will be remembered for her dedication, her fairness, and her selflessness. Mary did not like the spotlight, but at her last budget hearing in June 2014, and I was there, before she retired, as the board was acknowledging her contribution, Mary used her time on center stage to focus on gratitude for others. She talked about the contributions made by the board, the encouragement she got from her boss and her mentors, and the strength of the budget team. This was quintessential Mary, to put others first and build them up to be their best selves. Many people will remember Mary primarily as a mentor. When she was not sifting through billion-dollar budgets, Mary enjoyed cooking, travel, especially road trips with Tom, jigsaw puzzles, poker, and wine tasting. But mostly, Mary loved to read. She belonged to a book group comprised of friends and colleagues from the county for nearly 30 years. The women in this group would constitute Mary's best friends. She will be remembered for helping to grow and develop many county leaders and will be greatly missed by all who knew and worked with her. On behalf of the County of Santa Clara, I extend our sincere condolences to Mary's husband, Tom, their children, Megan and Daniel, and her many friends. Tom, would you like to say a few words? Or Megan, or neither?
Oh, now we're unmuted now. So thank you, President Wasserman. Our son, Dan, is in this crowd someplace as well.
Oh, wonderful. Hi, Dan.
But thank you.
I'm here.
I am not good at speaking. Megan, I think, is not at a point where she can speak, but we thank you for this memoriam, and thank you all for allowing us to come and view this.
Yeah, she was very, very proud of her work with the county and very proud of everyone she mentored and continues to be proud.
Your mom took good care of us. Thank you, Megan.
Yeah.
Thank you.
Thank you.
All right. And Dr. Smith, I believe, has something to say.
I just want to add my condolences to Tom and Megan and Dan. Mary was really the heart of the organization while she was here, served for 30 years in multiple jobs. I met her when I started just before she became budget director. She was a great person to talk to and get advice from. She really made the transition much easier for me, as she did for hundreds of others. She had an eye for numbers, but she really had a heart for people. And I really appreciated her and will miss her dearly. Thanks very much for coming in.
Thank you. Take care, Tom, Megan, and Dan.
Yes.
Thank you.
Thank you, Jeff.
With that, we're going to move on to public comment, which is the opportunity for anyone to speak about anything not on today's agenda, but still under the purview of the County of Santa Clara. And before we do that, board members, I just wanted to kind of say in advance what I was hoping to do. I was going to be brash and put items 10 through 41 on consent, but when we get to consent, ask that any item that any of you wishes to remove and be heard, that you each speak up individually as we've done before. And there may be 10, 20, 30, 40, I don't know how many items, but I'm hoping whatever items we don't need to speak on, we can handle in one clump. So I was just giving a little advance notice of that. With that, we will now turn Colin to our public speakers. And at this point, I see one speaker. Do you agree, Colin?
We do have at least 2 speakers at this point.
Now I've got 2. Thank you very much. Okay, let's give our first 3 minutes, and we'll see where that carries us.
All right. The next speaker is Cole Cameron. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. It's really great to have a team running our county like you with our executive, Dr. Smith. I'm here not to ask for money for a change. How's that? But to put a bug in your ear for future cycles. I've really built up a team in San Jose of the CERT team, Community Emergency Response Team, and we'll be getting maybe 300,000 or 400,000 out of the city to expand that so we get down to the block level and really have teams in every neighborhood, which is what I want to see us do for the 20 municipalities and pockets across the rest of the county outside of San Jose. The other thing that I'm very involved with is the NGO community under our VOAD that we call cadre that supports and trains all of them to be prepared as organizations for a disaster. And I just look forward to future conversations, understanding in more detail how future budget cycles work, as I am an old budget cycle guy myself for many years here in the Valley. I want to thank Supervisor Simeon for reappointing me and having the support of Supervisor Lee with some support to one of our key allies in the Veterans Commission, the NOAA Vet team, and the reappointment of yet another one of our veteran commissioners and the nice plaque we're going to give to our retiring board chair. What I would look for each of you to do is the following for our veteran commission. I'm an old guy. Many of our veteran commission members are of like personality. I'm looking to see in August the appointment of our first woman vet, very involved in the community in the South Bay. And I look to each of you to see if you can find other next generation vets to join us in that continuation so I can step back as a mentor and elder. Thank you again for all you do for us. Have a great meeting.
Thank you, Cole.
Our next speaker is Dr. Johan Hong. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Hi, thank you for having me. I'm Dr. Johan Hong. I'm a resident physician in internal medicine at Santa Clara Valley Medical Center. I'm a proud member of the Committee of Interns and Residents, SEIU, and I'm here to ask the board authorize hazard pay or surge stipends for residents called in due to staff shortages during COVID surges and other emergencies. As resident physicians, we've responded to the pandemic, being at the front line, taking care of sick patients. 80% of our members have signed and delivered a petition to the board asking for a surge stipend because after 2.5 years, we need our sacrifices to be recognized. In the last month, about 1 in 5 of us were unable to come to work because of COVID. This meant that in an already strained setting, we were being asked to cover even more hours, sometimes even being asked to cover a 28-hour call shift in the intensive care unit on short notice. Every day, I see the physical, emotional, and psychological toll this takes on my colleagues. Some of us, like myself, are parents, and we have not been able to see our children for weeks at a time because of how much we're working. Sometimes my 3-year-old son will stop me at the door and say, please don't go to work. This is really unsafe for patients because we're also being asked to work beyond our duty hours. And when people are tired, mistakes can be made. And as you guys know, duty hours were initially created because mistakes were made and there were patient safety issues when residents were being overworked in New York City. So we respectfully ask that the Board of Supervisors to support our petition and to schedule a meeting with our union to discuss this further. Thank you for your time, and I yield the rest of my time.
Thank you.
Our next speaker is Deborah St. Julian. I'm unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
I'm not sure. I want to comment on 25A and 26. So I'm not sure if I need to do that now or wait to see if you take it off consent. So this is kind of a informational question.
Thank you. Why don't you go ahead with your question? We don't know what will be or will not be put on consent at this time. This agenda is a little different than our normal ones. So why don't you go ahead now? That means you won't be able to speak when 25 comes up. What would you prefer, Deborah?
Well, I mean, I'm concerned I won't be able to speak because 25 won't come up. Do you get my question?
Oh, yes, I do. Why don't you go ahead and speak?
All right. Well, I'm Deborah St. Julian. I live in District 2, and I'm a member for Showing Up for Racial Justice, and I'm commenting on 25A because the county exec sent a last-minute memo telling the supervisors that there'll be a discussion of the board's capital improvement priorities in September 2022, 3 months after they're being asked to approve the budget. I am disturbed by the county executive's last-minute memo telling the supervisors that there will be a discussion of the board's capital improvement priorities in September, 3 months after they're being asked to approve a budget. This is backwards. The funding of the $689 million jail, but no funding for a non-carceral behavioral health facility does not represent the community or the board's priorities. You voted unanimously to declare mental health and substance abuse a public health crisis, and only 3 of you voted to build a jail. We urge you to set your capital improvements priorities and make sure the county exec's budget reflects them before approving the fiscal year 22-23 budget. We do this in our families. Establish priorities before approval. Do not approve before establishing priorities. And for item 26, I'm commenting on this. This is the recommended budget for the Facilities and Fleet Department. Our community needs a place for people who need help with mental illness and substance abuse issues to be taken care of. We need what you promised, a non-carceral behavioral health facility. Yet out of a $1,092,700,000 capital projects budget, the county executive only allotted 0.1%, that's 1 million, of this money to planning and executing a non-carceral behavioral health facility. You allotted 63% of the budget for a $689 million budget jail. This does not reflect the community's needs or priorities. This does not fulfill the board's promise to fund a non-carceral behavioral health facility. Put care first, reverse these numbers. Don't approve a budget until the capital improvement plan prioritizes the promised non-carceral behavior and needed and research-based non-carceral behavioral health facility you approved in January. Defer the jail until this is done. Thank you.
Thank you.
Next speaker is Catherine Hedges. I'm unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. My name is Catherine Hedges. I'm a resident of District 2 in Santa Clara County and a member of Showing Up for Racial Justice with Deb, who just spoke. I live in downtown San Jose, and every day I see many people who are struggling with mental health issues, and everyone assumes that they're not trying to get help, but resources are so short in our county that even people who want help can't get it. Our county simply cannot provide adequate community-based mental health care, even though it's been mandated that counties provide it since the 1970s when the state institutions were closed. I have a neighbor who has episodes every so often where just hearing foot traffic in the hallway sets him off, and he starts screaming at them and pounding holes in the walls. But he doesn't have anywhere safe he can stay at those times. For a while, there was some kind of community peer-based clubhouse, but that seems to have closed during the pandemic and not reopened. People suggest I call the crisis team, but that's unhelpful if the police are going to show up before the mental health workers, and I don't even know if he's making a specific credible threat of anything because I can't hear his words distinctly now through the wall except for the curses. I don't want to have the police in my building possibly shooting him because they've already done that to another tenant. My neighbor needs help from peer counselors, not cops. So this is why Serge is urging the board literally to put care first. Don't approve the fiscal year 22-23 budget until the capital improvement plan prioritizes the non-carceral behavioral health facility you approved in January and defers the jail. Thank you very much.
Thank you.
Our next speaker is Eugene Senda. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Dr. Eugene Senda. I'm one of the internal medicine residents at Santa Clara Valley Medical Center and a member of CIR. I am here to also ask the board to authorize hazard pay and surge stipends for residents called in during staff shortages during COVID surges and other emergency. As resident physicians, we have passionately responded to the pandemic, being at the front line for the past 2 years, taking care of sick patients and exposing ourselves and our loved ones to the risks of COVID for an average about maybe 80 to 100 hours a week and 28-hour shifts in the ICU. You know, after the tragedy of Dr. Jabalia's passing, I've spoken to many of our co-residents and interns, and I'm worried that many of our, health staff and residents are experiencing quite extreme workplace burnout. And I would like to proactively advocate for my fellow residents and prevent a similar tragedy from occurring within our health staff. I don't know what each resident is going through outside of work, but I can tell you that the work conditions are all set up for another tragedy from taking place. With regard to mental health wellness, we're unable to provide any additional days off for our house staff being called in because there aren't enough residents to cover. So again, we are asking for a surge stipend as outlined in our petition. We respectfully ask the board supervisors to support our petition and schedule a meeting with our union to discuss this further. Thank you again for your time.
Thank you.
And that concludes our request to speak.
Thank you very much, Colin. And before we move on to the rest of the agenda, just for clarification, what I'm actually going to ask for is not to place all the items on consent, and I thank County Council for this clarification, but rather to make a motion to move them all forward to June 16th for final approval, except those specific items any supervisor wishes to hear. And I was going to do that when we get to item number 10, but we have 5, 6, 7, 8, and 9 to do before then. I was just giving a heads up. And before we do go to item number 5, I want to ask staff if they have any corrections they'd like to make, like perhaps too many zeros in number 27.
Yes, President Wasserman, thank you. This is Greg Ituria, County Budget Director.
Hi, Greg.
And we do have 2 corrections to make. The first one is to delete action 17O relating to the funding of the criminal justice information system. This action will be just tomorrow and is agenda item number 54A. And then the second correction is to amend action 27B to reflect the correct dollar amount of $366,000 rather than the $366 million that was printed in the agenda. So with these corrections, I have nothing else to offer at this time.
Thank you very much. Third of a million, third of a billion. Good catch. All right. With that, we're going to move on to item number 5. Dr. Smith, it's the overview of the county executive's fiscal year 2022-23 recommended budget. Dr. Smith.
Thank you, Mr. President, members of the board. I just wanted to chime in a little bit at the beginning here. You're being presented with a balanced budget at these hearings. You have today, tomorrow, and Thursday. By Thursday, at the end of the meeting, you need to vote on a completed balanced budget in order to meet criteria required by law. Today and tomorrow and the first part of Thursday are an opportunity for the board to make recommendations to change the budget. However, we all recommend and realize that if you add something, you have to subtract something else. With that, I will turn it over to Greg Aturia, who'll go through the recommended budget department by department.
Okay. President Wasserman, members of the board. Again, this is Greg Ituria, County Budget Director. The recommended budget before you continues to address the impacts of the pandemic while maximizing the use of federal funding to help mitigate some of those cost impacts. The recommended budget was built with the application of an equity lens as departments developed their proposals that ultimately ended up in recommended actions contained in the recommended budget. The recommended budget is structurally balanced, meaning that recurring costs are within the amounts of recurring revenue. The recommended budget also continues to provide essential safety net services, while at the same time expanding the healthcare system to fit the community's growing needs, while at the same time preserving our service infrastructure, i.e. facilities, information technology, and preserving core community services. The recommended budget includes continued investments, including supplemental funding for the Adolescent Psychiatric Facility Behavioral Health Services Center that has been designed and is ready for construction. It also includes expanding services at the recently built Vietnamese American Service Center, as well as providing funding for the Secure Treatment Center and providing funding to replace outdated information technology and IT assets. It provides funding for the required hospital seismic improvements in our hospital system, as well as other facility improvement projects, including new health clinics in the South County, and also including the new essential services building at Silver Creek that has been designed and will be ready for construction in the next fiscal year, as well as providing continued expansion of the county's supportive housing services to provide support for people occupying in the new housing projects that have been constructed or near construction. The recommended budget was published at the end of April. The board reviewed the recommended budget in workshops on May 16th, 17th, and 18th, where the details of each departmental budget was reviewed and discussed. In this hearing, the board is asked to consider updated financial information and revised recommendations from administration, as well as the inventory of board member proposals that were reviewed at that May workshop, and as well as the actions necessary to rebalance the budget. At the end of this hearing on Thursday, we need to adopt a balanced recommended budget. As the county executive mentioned, changes can be made, identified during the week, but there needs to be equal and offset. So any kind of an addition needs a corresponding subtraction to keep in balance. New information since the budget was published at the end of April. It includes updated projection of realignment revenue and state fee backfill revenue based on updated projections from the state that we got as part of the governor's May revision to the state budget that provided increase in some of our revenues in the general fund. Also, new information that has been factored into the final calculations include the fiscal impact of board actions approved by the board after March 22nd, where there are cost or revenue impacts from those actions impacting our projected costs and projected revenue amounts in the next fiscal year. It also includes an updated ending fund balance projection. The ending fund balance projected is 36.7 million less than the amount that was estimated in the recommended budget, primarily due to revised estimates for federal pandemic funding. In some cases, the federal pandemic funding is reduced in our estimate. In other cases, it's delayed and anticipated to come in the future. The revised recommendation are agendized for individual consideration by the board, department by department. But the net result is an ongoing cost of $10 million and a one-time cost of $7.1 million within the general fund, and also an ongoing cost of $2.2 million and one-time cost of $14.7 million in funds other than the general fund. The additional adjustments in the final calculations in the updated balanced budget includes correction of errors and omissions that are described in detail in the reports in your packet, as well as concurrence with findings from the management auditor review of the recommended budget that provide $14.7 million in budgetary savings. All of these adjustments net out to require an $11.3 million in cost to the general fund that needs rebalancing. Also, in order to comply with the Board of Supervisors board policy to have the contingency reserve established at 5% of general fund revenue, net of pass-through revenue, and an increase to the amount of the general fund contingency reserve of $3.7 million is necessary to comply. In addition to that, to rebalance, the administration is recommending decreasing the federal and state budget impact reserve. This, in effect, zeroes out that reserve because it takes it from 5 million to 0, leaving us without a reserve with this action. Also, to balance, the administration is recommending a transfer of $10 million from the accumulated capital outlay fund to support the recommended capital budget. All of the numbers that I've described in the amounts, we've got, of course, in greater detail in the agenda packet, but just for public airing here, I show the math so you can see that all the changes in the end net out to 0 at the very bottom. And then as requested by the board at our last board meeting, for a couple of slides talking a bit about the future and the threats to the budget, we have a couple. And first is to give a bit of a preview with potentially, I think, more for concern for fiscal year after next. But we have a couple of trends that are of concern and we should all keep in context. The first is the property tax base growth rate is slowing compared to what it has been in recent years. And there is broad concern that rising interest rates will flatten out that trajectory for the county's primary discretionary funding source. While at the same time, inflation is significantly impacting the county's services and supply costs is anticipated to continue to have that impact and pressure for growth in costs in the coming years. And of course, the cost of employee wages and benefits are also expected to continue to grow for a variety of reasons. Even if the staffing remains the same for the next couple of years, the cost will go up. The contributions for the CalPERS retirement plan are expected to go. And while we don't know yet what the cost increase is going to be for year after next, given the loss in some investments this fiscal year, it's anticipated that the future actuarial reports will show that additional amounts need to be contributed by public sector employers, including the Santa Clara County. We're also seeing the cost of healthcare go up, and that is passed on to the county in some of our costs as well for the cost of health insurance for employees and retirees. And then the second category is in collective bargaining agreements. Right now, we're only actively involved in discussions with a couple of our bargaining units, but just as a reminder, on our horizon over the next couple of years, we will begin negotiating with some of our largest labor groups, well, with our largest labor groups. And given the cost pressures in the economy, I anticipate that there'll be some pressure there for cost to grow as well. All this while we've got minimal reserves in our uncertainty for uncertainty beyond the general fund contingency, in part because we had to tap in and use those reserves over the last couple of years to respond to the pandemic. So just as a reminder, we're depleted in reserves as we're going into a period where we have concern about the economy approaching recession, perhaps, and concern about labor costs, pressure to grow labor costs, perhaps more than modestly. And then finally, just to mention some more outside threats to the county budget. From the state, perhaps one of the more immediate threats is legislative efforts to divert some of the county's local property taxes away from the county to fund other state or other agency obligations. And also the potential, challenge of new mandated services without adequate funding from the state. So as many of us have been tracking, the state has a budget surplus, and there are a lot of ideas being discussed by the state legislature to use some of that. And sometimes how they'll use it is provide mandates to local governments, including the county, to provide new services, but not always with adequate funding. One of the challenges that we've faced here in the past and we may face in the future is when the state comes up with their formula for funding for mandated services, they look at counties on average, and they'll come up with an allocation on average. So the funding may be adequate for a small mountain county or for the cost of providing services in the Central Valley, but not necessarily adequate for the cost of providing services in the Bay Area, and in particular Silicon Valley. So this is always a threat to keep in mind when we see the state wanting to grow and partially fund some of that growth. And then also on the federal actions, the board and the county has been successful in getting adequate federal funding to some degree, as they've passed waivers for help provide supplemental funding for our healthcare system. But there's always been some degree of inadequacy with that and concern for further inadequacy. And to some degree, it's a similar dynamic at the federal level. They'll come up with rates for Medicaid or other funding formulas that on average for most states seems adequate, but the cost to provide healthcare services in California, particularly in our valley, is certainly higher than, let's say, in Iowa or Idaho or Florida. And so there's always this challenge of not quite getting adequate funding from federal actions as well. And then I must also mention again, one of the biggest challenges we have right now is adequate and timely reimbursement for our pandemic response costs, particularly by FEMA. As the board is well aware, the costs that are being incurred right now for the pandemic response, much of that's not going to be reimbursed until later this decade. And even then, there's always the risk that it's only partial cost recovery. And then the last threat, I've already mentioned it again, but just I think it's worth pointing out one last time, is the cost of inflation and how it impacts the services and our supplies, the cost of capital projects, and the pressure it's going to put on our workforce. And while at the same time having its negative impacts on our property values, our assessment values, and therefore our property tax collections, and as well as other tax base, sales tax base, etc. So all these are just for us to keep in mind, particularly concerned about fiscal year after next. And that's it for our overall presentation as we get ready to embark on the particulars and requested actions of the board. At this point, let me pause to see if there's any questions of the board.
I was muted. Thank you very much, Greg.
Okay.
Board members, all right, there she's one step ahead of me, Vice President Ellenberg.
Really briefly on this one, I first just want to thank staff for the really tremendous work on preparing the budget. Overall, personal gratitude for incorporating my direction on several items from the May workshops, including the early childhood workforce support, small business recovery grants, small social detox beds, and a few other items. I'd also like to offer some direction for next year's budget process during this overview section. I was really glad to see the strategic objectives section this year, and I would like us to set aside time during the second board meeting in January for the board to again discuss and approve the strategic objectives for next year's budget. And then next spring in the recommended budget, I'd like to see explicit linkages between those priorities and the investment decisions that we make. Increases in departmental allocations should be aligned with one of those strategic objectives. And where I'm really trying to get is to emphasize that the board has a fiduciary responsibility to the public for the allocation of taxpayer dollars. So it is really imperative that we have oversight and authority over investments and the confidence that they align to the community priorities, especially, of course, given the limitation and resources that were pointed out earlier by Dr. Smith and right now by Greg.
And that's.
So I would like to include that direction in the in all of the actions that we move forward today.
Gotcha. Thank you very much. I'm going to try and switch back. Supervisor Chavez, I'm going to try and switch back to full screen here because I don't like this 6 people on the side thing. Supervisor Chavez, go right ahead.
Yeah, thank you. And staff, if this is going to be brought up in a little bit, I'm fine with that. But I was wondering if you could talk just for a minute about the cost of living pressures relative to the workforce, and you listed it in a number of other areas. And there are two areas that I'm particularly interested in. One is the implications of that as you see it relative to our employees, and the second is the implications of and the impact of inflation on projects. And I recognize we're gonna talk about, I'm gonna pull FA off because part of the reason I wanted to better understand how you account for that relative to construction in particular. So that would be just an overarching question.
Let me try to answer the.
Thank you, Dr. Smith.
In terms of the effect that inflation will have on our workforce is sort of multifactorial. They will obviously feel the increased stress of increased costs of gas and other products and services that they pay for and are provided to them. Additionally, you'll see more demand from our clients because they are going through the same inflationary problems as everyone else in the community. So at a time period when the funding from our external sources is going to be decreasing, we'll have more need, and that need will be both from our employees and from our clients. The staff plans on working with the board in closed session on exact implications for each bargaining unit. There will be some bargaining units that will need significant readjustments, others less. We'll have to seriously consider what our general wage increase policy will be. In the past, the board has had a specific direction about general policies. We'll have to reevaluate that in closed session. We are going to see a divergence between increasing property taxes, which will not pay for everything, and decreasing subventions from the state and the feds. So there will be more and more pressure on the budget. I expect next year will be challenging and the year after that will be very challenging. In terms of the effect that it
Dr.
will
Smith,
have on.
can I stop you there just on that one topic? I think that you raise an excellent point as it relates to what this means as we go into the next series of collective bargaining. And colleagues, what I would like to offer as an addition to the any action that's taken today is that we have an earlier discussion about the broader framework of our approach in closed session, recognizing that Dr. Smith, I presume that we are on an ongoing basis having discussions with our bargaining units about any number of issues, so that we're better able to think about this in a more holistic way. I think that would be helpful if we could hear that much earlier and broader as across all of our bargaining units.
Yes, we'll have more detail for you after the break. We're preparing recommendations at this time, and then specific recommendations before each particular union negotiations. Right now, SEIU discussions are going on. They're not formal, full-blown negotiations at this point, but there are discussions going on about obsolete department agreements and other issues that need to be addressed that are technically called non-financial, but obviously everything is financial.
Right. Thank you.
You also asked about the effect that we anticipate inflation having on capital projects. That's a hard one to answer.
Yeah, Dr. Smith, let me be more specific. What I mean is, what I was interested in is, what do we think the implications are for debt service relative to projects that are in the pipeline now and projects that we're going to be discussing later?
Well, in terms of debt service, we have really great credit ratings. So when we sell debt, we get very good interest, and we're always watching our debt payments on a yearly basis to make sure that we don't overextend ourselves. We're well below the requirements. We're in a very good position. The cost of capital improvements is probably the riskier component of expenditures, because we know that the cost of steel, for example, has gone up significantly. We expect the cost of other raw products to go up significantly. So it will be more and more difficult to predict exact costs of new capital projects, which means that there will be challenges with getting those projects up and running.
So again, colleagues, this would be a recommendation for action that the board may take as part of budget. I do think that one of the things that we heard was an audit of how we're managing debt right now in FGOC. And one recommendation that I would like to make is that the report out, when we're getting the report out on cash availability, that we're also getting a report out on the total that we're spending in debt, to service debt for construction as part of that report out. And the reason I think that's critical, I think, Dr. Smith, you're exactly right, that the next, for some period of time, the fluctuations, both relative to supply chain and then inflation overall, are going to be significant, and being able to track that so that we can be both opportunistic and still ambitious in our construction projects, I think is going to be really critical. But I also think it will help the board make decisions about how we want to extend ourselves relative to debt. And I thought the FGOC report, the audit, was really helpful in helping me think about that. So I just think that the board may need to take a little deeper dive into that in the fall. Thank you, colleagues.
Thank you. I'd also caution everybody, when you think about debt service, as Dr. Smith said, we're the highest rated county in the state of California. So our debt is the lowest, but our debt costs could well be higher next year. as the Fed raises rates to fight inflation, and then it could be lower if in fact a recession comes along and the Fed needs to lower rates to stimulate the country. Interesting times ahead. No other hands raised. We are going to, and no members of the public with their hands raised. Colin, I'm going to move on to item number 6. 5 was to receive, so no motion necessary. Item number 6 is to consider recommendations relating to the Harvey M. Rose Associates review of the fiscal year 2022-23 county executives recommended budget. And we're being asked in here to receive a couple of reports. And I'm looking on my, there's Cheryl, there you are.
You found me.
I went from too few faces to too many faces. Cheryl, go right ahead.
Thank you, President Wasserman and members of the board. I'm not quite sure what your preference is on proceeding today. The administration has accepted about 14.7 million of our identified 37.8 million in potential reallocations.
Let me ask the board members this, Cheryl, in answer to your question. Of the 16 items delineated on package page 34, I see that you and administration are in agreement on 12 of them.
Yes.
Is that's still the case?
Yes.
Okay, thank you. So board members, would you like to hear an explanation of the 4 from Cheryl, the distinction, or do you have questions for her and or Jeff? What's your pleasure? Supervisor Chavez.
I was really interested in them. And Cheryl, if you could go through the 4.
Sure.
Yeah, thank you.
Cheryl, go right ahead. Start with number 4.
It's actually 5, but yes, I can go through them. So the first one, which, as you mentioned, is on packet page 34, line item 4 in table 1 is the general reserves. And what this is we were looking at the fact that there's about $8 million already in reserve for jail security projects. And so this would just add to that, making it over 11 million. And, you know, there's no real project scope, or there's no vendor. We don't know exactly what the funds are for. And given all the pressures just described, we were kind of thinking that maybe they should spend the 8 million that they already have on reserve and not allocate this to that bucket just yet.
Thank you very much. And I see the additions, item number 16, that I missed at the bottom. And those are the 5 items. Supervisor Chavez.
Thank you. That's helpful. Maybe if Dr. I see Greg has his hand up. I was just interested in the exchange from staff. Thank you, President.
Okay, we'll do this like a debate. Great.
Yeah, President Wasserman.
Lincoln Douglas.
Members of the board, thank you. Yeah, Greg Etruria, County Budget Director. Yeah, the management audit report refers to the jail reserve. This is a reserve set up by the board after a large number of jail improvement related projects were funded in the past, mostly in compliance with the consent decree requirements for improvements for ADA accessibility. And the amounts that were set aside a couple of years ago for those improvements, we suspect as they continue to make progress on them that the amounts won't be quite adequate. And part of it is because of the inflationary factors that we were just discussing a few minutes ago. Another part of it is getting access into to do the work and particularly at Elmwood, but also in the jail as well, is taking some time. They need to be very coordinated between the contractors, FAF staff, and jail operations. And so some of that is taking a little bit longer for the sequencing. So this reserve is set up because to help be the extra funding that's going to be needed for some of those projects. We don't know until each of those projects, as the costs kind of get flushed out, which ones are going to need what amounts. So the amount it's in reserve is the best estimate for how much is going to be needed in a wide variety of these projects. We just don't know which ones just yet. So that's why the staff is recommending that we still hold on to that reserve.
Thank you. Counterpoint. Cheryl.
Well, I mean, it's obviously a policy question for the board. And, you know, I think unless there's further questions about it, I don't really have anything else to add.
Thank you. And I do not see any hands raised. Let's continue on then to item number 6. Cheryl.
Item number 6 is, it's a little bit complicated because it would have to come from rollover funds for projects that are on hold. So typically projects are allotted funds through a code, and if those funds are not expended, then they would be rolled over into the next year's budget as part of the regular rollover process. But these were projects that really were not on track to be completed in the foreseeable future. And so we were thinking that maybe those funds could be reallocated to more pressing matters in the upcoming fiscal year.
Thank you. Greg.
Yep. Just a point of clarification here too. And I believe the management auditor's office sent out an informational correction to board offices after the report. But at this point, the recommended budget does not include the funding that's described here for these projects. And so there's nothing to offset right now in the recommended budget. The funding for these projects were projects that were funded in the past, and the department TSS is working on their reappropriation request for those that still need to be continued. They're working on their preliminary report to the board for the June 28th meeting, and that come back in likely September, asking the board to take formal action at that point for how much of additional funding needs to be retained for these projects that were funded in the past. So there really isn't an adjustment to be made at this point. And I think that clarification was made subsequent to their report from Ms. Solov. So
Yes.
that's the reason why at this point we show a 0, because it's not part of the budget right now. It's something that needs to be worked on later on when those reappropriation requests are developed and considered.
Got it. Thank you. Supervisor Chavez.
I would love to comment on this, but I see another hand up of somebody who may have.
Yep, that's from Anna, principal analyst. But you want to comment after she does?
Sure, thank you.
Sure. Anna.
Hi, everybody. Anna Chinkin, Board of Supervisors. Can everyone hear me?
Yes, we can.
Okay, great. I just wanted to make a comment on this item in particular. Greg, you mentioned that there's going to be points of clarification that come to the board subsequent to the budget hearing process. I just want to put on record that this is the budget hearing process, and there have been several, if not multiple instances of very large adjustments coming to the board for action subsequent to the formal budget hearing process. So I just want to make a formal comment to be on the record that these adjustments, Greg, really should be happening now during the budget deliberation process, so that it's clear and transparent what the rollover funds are actually being used for.
Thank you very much. Supervisor Chavez.
Thank you. So on this front, I think that TSS has had a kind of a little bit of a challenging history relative to how much money is set aside for projects that may or may not be online over a number of years. And one of the challenges with TSS is that in some respects it functions very much like FAF, because so much of its projects are multi-year, almost the way you would construct frankly, anything that we're constructing. So one request that I would like to make is that we had, as part of a previous audit, we had a discussion in FGOC about how we were funding this particular department, what money needed to stay to be able to look at multi-year projects, and frankly, what money wasn't going to be drawn down over any period of time. And I do think right now that, and maybe we should be discussing this under TSS, but what I want, and I was actually going to pull that off to have this discussion, but what I would like to recommend is that TSS actually go back to FGOC with an updated project timeline and work plan that looked at a 3 to 5 year period of time, but that in fact, when you prioritize these different projects, to determine what money can come out of that and go back to the general fund. Because I do think that I recognize it's very complex, but we're also holding resources that may or may not be drawn down. And the second part to that is, actually, I'll talk about the second part when we get to TSS. But right now, I do think that's a very critical issue that needs to be examined by the board in a much more rigorous way than based on the audit we've already had of TSS.
Thank you. Dr. Smith.
Yeah, I just wanted to add a little bit of context here. TSS projects range in a lot of ways, from very simple, relatively simple projects to very complex ones that take many years. And administration has realized that we cannot accurately predict the cost and need for TSS projects for a year in advance. And so we've planned on doing periodic reviews on a regular basis and reprioritizing the funding. And the board will obviously be participating in that, so it'll be completely transparent. But the fact that technology changes dramatically within a year, used to be, TSS projects were obsolete in 2 years. Now it only takes 6 months. We feel that we need to review it with the board on a regular basis and reallocate funding, and that will be very transparent at the board level, and the board will have to take action about it. So that's why Greg mentions that we're reassessing at this point to make sure that we have allocations that are appropriate and timely, and that we've not rolled over any funding for projects that we think are obsolete or will be obsolete soon.
So does that mean, Dr. Smith, through the chair, that this will come back to the board in the first quarter of next year? I mean, like fall of this year?
Yes.
Okay. So yeah, I think then that addresses my need. I think what I would just like to recommend is that as that report comes forward to the board, that through Supervisor Lee, through FGOC, that we make sure that this is heard before, I think all of our colleagues should hear it, but so that we can drill down into the details at FGOC, so that the report comes to FGOC, that the management audit team review that report and be prepared to report with TSS at the same time with us, so that we understand all different views on this issue, because it is actually a lot of money that we're holding here. And then the other thing, and again, we could talk about this under the other part of the under TSS, is I'm also interested in understanding whether or not any of the ongoing money being set aside for projects really should be set aside for staffing, because it appears that we're having a challenge with getting RFPs out and RFQs out and doing some of that legwork that needs to be done. And that so I'm a little nervous about that department's just ability to manage all of this also. So if that's okay with Supervisor Lee, I'd like to request that again on the record with my colleague's consent.
Supervisor Lee said yes.
All right. Thank you very much.
Thank you. All right, Cheryl.
So let's see. The next item is item
Number
7.
9.
Well, yeah, let's see.
What number would you like to do?
Well, item 7, the administration has accepted 1.65 million of their recommended 10 million. And this is for the Office of Supportive Housing. Part of the discrepancy is related to we took some information that was contained in the budget that shouldn't have been in the budget, which has since been corrected, as I understand it, or is being corrected. But overall, we still think there's some additional funds there that could be used other than general fund money for these projects. So
Let's see that. Greg.
Yeah, the references to the fund balance and the RDA set aside housing fund. And at this point, the board has already committed the use of those funds, all but an estimated 1.65 million has already been committed to other housing projects. And since these dollars cannot be spent twice, if there's a desire to spend those funds differently on new projects, we would have to have the Department of Supportive Housing come back to the board and ask what other housing projects previously funded by the board would have to be cut back.
Okay. Cheryl.
Well, without some more detail and knowing exactly what these are committed to, it's a little hard for us to further assess without some more detail on this. So.
Okay. Not much more to be said on that one. All right, go ahead.
So in terms of 9 and 10, if it's okay, I can take those together. 9 and 10 are both from the district attorney's office. The administration is correct that these funds are actually from a different fund, not the general fund. However, the funds that are listed there as potential general fund savings are still present, in our opinion, at the bottom line object to services and supplies level within the general fund portion of the district attorney's office.
Greg?
Yeah, the reductions that were specified in the report, as Cheryl mentioned, are ones that are funded with outside funding sources. And so there's no general fund savings. If you reduce the expense, you also have to reduce the revenue that would be transferred in from other funds. So there's no net zero savings there. That's why there was a partially concur amongst these to reduce some of the budgeted amount, and but we'd have to reduce the amount of revenue transferred in from these outside funding sources to keep it honest and balanced. And then later on, if during the mid-year process or some other time, if the district attorney has expenses incurring at the higher amount, they could always come back to the board and demonstrate that and ask for an adjustment at that time.
Thank you. So Dr. Smith, that's an area such as South County Youth Task Force that's just not included in this at this time in the recommendation.
Correct. Yeah, not at this time.
Okay, thank you. Supervisor Chavez.
Yeah, I want to make sure that what I understand here is that the district attorney's office has acquired resources from other entities. And what you're saying is, irrespective of the source of funds, we want to make sure that they go through the appropriate process for disbursement, which should or could include them coming before the board for final approval. Is that accurate?
Well, not quite. What we're saying is that, yes, these particular line items should have been identified as non-general fund, so it's an error. And I'm trying to correct that error, but to point out that at the bottom line level, the department still has excess funding that is general fund funded at that level. And so, in other words, what I'm saying is you could take the funds from some other line item, if that makes sense. In other words, there's excess funding at the object 2 level in the DA's budget.
That could be reduced by 575,000.
Right.
Oh, I see.
In other words, right. And so because appropriations are at the object level, we tend to, pick certain line items that we think might be, ripe, if you will. But those are just suggestions. You could take the funds from something else, I guess is what we're saying, from some other line item that's unexpended.
Okay, Cheryl, there you lost me. I don't really understand that outcome here is you're saying they have extra money in their general fund in a particular line item that could go, I'm sorry, that is within their budget, that's general fund dollars that wasn't spent last year that they won't need this year and could be put into the general fund.
That's already in the general fund, but is budgeted in this area, but will not be expended. So you could reallocate it, what I'm saying.
Like object 2, unused object 2 in a supervisor.
Object 2, in other words, you have an object 2 of like 29 million and their past expenditures and current year expenditures are like 4 million.
Got it.
So there's money at that object level.
Yep.
And then we provide some, potential line items to consider, but the budget is not appropriated at the line item level.
Thank you.
I apologize for the confusion.
No, that's not you. That's me. Thank you.
Okay, Cheryl, please continue.
So I don't know if there's further questions on that.
No, there are no other questions hands raised on that.
If not, I'll move on to item 16, which is BMC general fund transfer out. And so what this is the Children's Health Initiative in 2001, fiscal 2001, the Board of Supervisors set up a new fund for the Children's Health Initiative. And the monies that were moved into that fund were from the tobacco settlement monies. And so they were allocated in about increments of about $3 million per year from tobacco settlement funds. And what's happened here is that the administration has basically taken this fund and decided to fund general operations of the Valley Medical Center with the fund balance that was sitting in that fund that was established by the board in 2001. And so, we were looking at that fund balance and those transfers, and, I'm not sure where these are one-time monies essentially that they're going to use to balance the VMC budget this year. So that's kind of our, we think there's some excess there that could be retained in the general fund for reappropriation by the board.
Thank you. Greg.
Yeah, the recommended budget recommends transferring that entire balance as part of the general fund investment or subsidy to VMC to pay for operating costs over there, because the costs are now for these services are now being incurred in the hospital funds. And so the amount of general fund subsidy or investment to support the operations at the VMC has already factored in and used that $11.9 million fund balance. So it's all used. There is to go in and use it again as proposed in the report. You can't spend the same dollar twice in two different things. So it's already fully accounted for and used in the recommended budget. So there's nothing there to reduce unless you choose $3 million of services, $3.4 million of services to cut in the VMC budget, we would need to know which hospital and which services if we were going to try to actually do that.
Thank you. First Jeff, then Anna.
Just from a policy perspective, take the board back a little bit. The Children's Health Initiative was begun when there was a spread between coverage on Medi-Cal and other insurance, so that the county felt that we needed to provide coverage for that so-called missing middle. Since then, the reimbursement for children in Medi-Cal has changed, and our number of kids that are qualified for the Children's Health Initiative has gone down dramatically. So they will continue to be served, but they're served through Medi-Cal now and general fund for the subsidy. So having this program separate from the hospital doesn't make much sense because the numbers are so small. Numbers of clients are so small.
Thank you. Anna, then Supervisor Chavez.
So for this item, I would just like to note that the fund balance in this Children's Health Initiative Fund has accumulated in this fund by virtue of monies being appropriated there annually and being unspent. So I think it's a little misleading for the county budget director to tell the board that this money is integral to the services at VMC when it's this money hasn't been spent for over 4 years and thus accumulated in a fund that's now being transferred to VMC without benefiting the general fund as a result. So it's a policy decision for the board, essentially, is what this item comes down to.
Thank you. Supervisor Chavez.
Yes, thank you. As part of, this is something I would want to again recommend to my colleagues, is that as part of the final budget action, I do think that we should have a discussion about the tobacco settlement funds. And just as a reminder, part of the reason they're still sequestered is that a number of years ago, I understand that through another budget process, we were discussing the use of these funds because Dr. Smith was right that we no longer needed them to fund the health program once we were getting children signed up for health insurance. And I would say that I think the decision the board has an opportunity to make now is whether or not we want to continue to use tobacco funds or children's health. And just some examples of that, we're focusing on mental health services at schools. We're focused on, and frankly, for access to insurance, we're still in the process. We still sign people up. We still need to do that. We still need to, we have the baby wellness program where we're trying to get parents to sign up for their children while they're still in the hospital. We know there's an underutilization and under access of dental insurance and dental services. And we know right now that we're trying to fund mental health screenings at schools. So what I would want to recommend, and I want to go back and better understand what the amount that's left in, if it's 3.4 million or not, because I'm still not understanding that between the two parties, is that we hold that 3.4 million in the fund so that the board can actually have a discussion about what it would like to invest that resource in. Because what we never did is we never said, we did say we don't need it for this purpose, but we kept it intact in part because we were trying to determine what other needs there were in that children's health, specifically health environment. And we do fund out of the general fund a number of organizations that do this kind of work. So I think it's worth, and Dr. Smith, maybe you can give feedback to this. I think it is worth us having a discussion about pulling the money, the purpose of pulling the money, and then whether or not we can be utilizing it for children's, specifically for children's services, even like the Black infant health work that that Supervisor Ellenberg has led on. So anyway, I'm curious about your feedback on that, Dr. Smith.
Dr. Smith, question being asked, then Vice President Ellenberg.
The recommended budget before you envisions that money being spent on kids through VMC, which is what is currently going on. If you hold it in the community fund, you'll have to find another 3.4 million to take out of VMC.
To balance. Supervisor Chavez, a comment, or I'll turn to Vice President Ellenberg.
I was actually going to ask, I think Dr. Smith, where I'm lost a little bit is the staff, and perhaps Cheryl, you or Anna want to respond to the 3.4 million specifically. I don't think they're asking for all of it. And so I just wasn't sure why there was 3.4 left in that fund.
Because from a policy perspective, there's no need for that money to go into the Children's Health Initiative because there are essentially no kids left that qualify for it. And the care is being delivered through VMC and the other 2 hospitals and the clinics. So we were keeping money connected with where the program is being provided. If you want to spend 3.4 someplace else, then you have to take 3.4 out of the enterprise fund, another 3.4 out of something in the enterprise fund.
So Cheryl, just to make sure I understand this, the reduction is that 3.4 million is based on previous expenditures, or because what you're saying essentially is that money won't all be spent, or it's not currently being spent the way it's structured in the county executive's budget?
No, that's not quite right. What happened is previously the board decided to dedicate funding directly to the Children's Health Initiative. And the money was not used because fewer kids qualified for the Children's Health Initiative. So it accumulated a balance. So that 3.4 is the balance. So in order to put the money where the service is being provided, we're recommending that you allocate that to the 921 enterprise fund. And if you don't want to do that, if you want to keep it in a reserve or spend it on something else, you'll have to take 3.4 million out of the enterprise fund.
Thank you. Cheryl, what I was trying to understand is how did you get the 3.4 million?
Supervisor, sorry, if I could step in here, Supervisor Chavez. The 3.4 million is the annual appropriation for the Children's Health Initiative Fund. In other words, it's the amount of expenditures that you appropriate annually for that fund for, kids services. That money, the 3.4 million, as I said, was being annually appropriated, but it wasn't being spent, at least not out of the fund where the appropriations were. So it accumulated the fund, the Children's Health Initiative Fund, accumulated a fund balance of $12 million that the administration is proposing to transfer to VMC. In other words, VMC already has an expenditure budget of $12 million for this fund. What we're recommending is that you reduce the appropriation for VMC by $3.4 million, which is just a fraction of the fund balance that's already appropriated in VMC. Does that make sense?
It does, but what I was asking, and I'm sorry I'm not being more clear, but let me just say back to you so I make sure I understand what you're saying, is that annually there's a $3.4 million expenditure, and that you're recommending not expending the 3.4 million, but the ending, approximately 7 million that's left would go to fund VMC, and the 3.4 would be spent on other things that the board determined were children focused or whatever other focus the board was interested in. Is that what you're saying?
A little bit reversed. What we're saying is the actions recommended in the recommended budget, you already would appropriate $12 million in VMC expenditures by virtue of transferring the Children's Health Initiative fund balance to VMC. The fund balance in the Children's Health Initiative fund is $12 million. And that is because annual appropriations into that fund haven't been spent over 3 years or however long. So what we're saying is, instead of, appropriating all that unspent expenditures over however long that that led to the $12 million fund balance, reduce that appropriation by 3.4 million, which still leaves about 2 years of expenditures in that fund in VMC, to use on children's health services. Essentially, don't appropriate all of the unspent money that's accumulated in this fund and that's being transferred into VMC all in 1 year.
Thank you, Anna. I think what I was trying to understand is why 3.4 and what the implications of that were. So either they didn't really need the money, and so that number makes some sense, because what the staff is saying is, based on the way they've structured the budget, all of that money is being swept out of this account into VMC's fund. And that's what I was trying to understand. So essentially the administration is saying that money is already going to fill a bucket. And you're saying, yes, but if you withhold this amount, they don't need
Right.
it.
Well, they're filling the bucket, but there's no outflow out of the bucket. So we're saying that because there's no outflow out of the bucket, you don't have to fill the bucket by as much.
Yeah, okay.
Does that make sense?
It does.
That make
Just
sense?
you're making as big, I mean, the different, well, yes, it makes sense. It's clear to me now. Thank you.
Vice President Ellenberg.
Thank you. And Anna, thank you for getting us there. I need just a little bit more of a push, and then I have a question. How did you determine that it was 3.4 million that should be held back as opposed to 5 million or 8 million? Or
that is based on the historical annual appropriations into the Children's Health Initiative Fund. So basically the budget that historically the board appropriated in there.
So you're holding back 2 years?
1 year. 1 year of appropriations. Or roughly 1 year.
Mm-hmm. And this is all Prop 10 tobacco tax money that we're talking about that has come in.
It's all tobacco tax money, and and so what we're talking about is, trying to reclaim 1 year's worth of expenditures as the rest of the funds are reallocated.
It already seems very generous to approve the 9 million of it to VMC. The tobacco tax money is very specifically for children. The amount is declining every year, which poses, and it's not entirely unrelated, poses an existential threat to First Five Santa Clara County, as well as the rest of the First Fives, because they are fully dependent on Prop 10 money. And at some point, it may be the county's responsibility to fill more of those roles. And to me, decimating that fund that is intended for children to get sort of blended in with VMC, and Dr. Smith, yes, I heard you say that some of it could be spent on kids. I don't know that that was the original intent, but I think the integrity of this fund is really critical. And what would have been the alternative plan, Greg or Dr. Smith, had you not decided that this children's fund should be available to just morph into the VMC fund?
Dr.
Well,
Smith and Greg.
Let me try to clarify. This fund was created when there was an insurance program created.
Right, I understand that, and we don't have the
It's
KID program.
it's not a kids fund, it was an insurance fund. Money has not been used from this fund for many years.
Sorry, let me just get a clarification. I'm sorry, I'm interrupting. I just want to make sure I understand each piece. The Prop 10 designation was not specifically for an insurance fund. It was for, is that correct? It was more broadly for.
This is not Prop 10 money. Craig, go ahead.
Yeah, I'm sorry. Just, I want to make that point of clarification. This is not Prop 10 money. This is not property tax money. This is discretionary dollars that's been transferred from the general fund in reference to tobacco settlement, which is not property tax.
I wasn't saying property tax. I was saying
Okay.
tobacco tax.
Or I mean, not. It's not tobacco tax. I'm sorry. It's
Oh.
not tobacco tax. So a point of clarification.
Oh, thank
Prop 10 tobacco tax is not in play here at all. This is a transfer of discretionary dollars from the general fund to the CH fund that was set up in the past in reference to tobacco settlement funds, which are discretionary in nature that were received by the county a long time ago. They recognized that due to a settlement, when there was a lawsuit between most states and most counties in California sued the tobacco over false advertising. And then there was a settlement and some discretionary dollars received as part of that resettlement. In recognition of that funding, the board decided, well, let's send some general fund money out to fill this insurance gap. But then with the Affordable Care Act and the expansion of Medicare, we got new coverage for those services that used to rely on this subsidy. And in the last few years, we've actually been suspending that $3.4 million through the recommended budget, and the board has agreed. For several years, we've been suspending that contribution because it hasn't been needed. And there was conversation about we may not even need the fund because depending on what happens with the expansion of the Affordable Care Act, which was under threat in the last presidential administration. And when they got settled, we gave forewarning in the past, we probably don't need this. And that once we felt more confident the Affordable Care Act was going to stay, we would be able to come in and fold this in. So really, this is just carrying out that past policy discussion that we've had over the last couple of years. It's discretionary dollars, and the recommended budget is balanced, to use that right now to help fund the VMC budget.
Okay, let me make 2 points. One, it sounds like the policy was to segregate these from general fund dollars for a specific purpose. If that purpose doesn't exist anymore, the board should have had the option before we're boxed into this. Well, if you don't want the money to go there, we, the board, days before the budget is due, needs to be the entity that finds a replacement. One of the things that, again, thinking to next year, because I feel that our options are limited this year, is that decisions of this magnitude absolutely should come to the board because they are policy decisions. The board should have had the opportunity to get clear information. I assume, I don't know what the total amount of the settlement is or was. The fact that we've been designating money to it each year is interesting to me because the settlement must be a finite number. And right now it does feel that we're really kind of very much backed into a corner of not having the opportunity to really make a policy decision about whether this money that a board long before I joined said should be for a children's health insurance program, that the current board should be able to say, well, we don't need it for CHIP and the children's health insurance anymore. We want to use it for X and not have it just simply disappear.
Well, you can do that.
Before we go to Cheryl, I need to go to Jeff.
You can do that, and this is the transparent, recommendation. I'm just saying that if you do that, you have to take 3.4 million.
Well, that's my point, is that it's very challenging at this point to find that 3.4 million. What happens if VMC just simply has 3.4 million less? What changes would have to be made on the other side to do that, as opposed to assuming that we need to backfill that 3.4 million? Are there things that could be, and I'm really just kind of asking intellectually, are there not things that could not be done in VMC or could be pulled back, as opposed to presuming that we have to backfill that 3.4 million?
Not quite sure what to say, except to say that that's why we have a recommended budget that's delivered in May, and we have the budget hearings to discuss. You know, it's really up to the board.
Okay, thank you.
Thank you. Cheryl, your hand is raised.
Yeah, I just wanted to point out that, you know, this is going in for just general operations for the hospital, which means that if operations continue next year, you'll have to backfill this money because this is essentially, you know.
Right. This will be a new ongoing.
Right.
But it's 12 million. So how do we, does that mean that we would need to add 12 million every year, or even the 9 million if we back out the 3? Is it an overall ongoing increase in VMC funding?
Sure. Cheryl, would you like to speak or have Anna speak now?
Well, I mean, I think that's a question for the administration, what their plans are for this, you know, funding these services in future years.
Okay, we'll go to Jeff. We'll go to Jeff and then Anna.
The enterprise fund every year takes a subsidy from the general fund, and this last year was particularly difficult because of COVID. So you'll notice the general fund subsidy is quite a bit larger than it has been in the past with the 3 new hospitals and new expenditures related to COVID. It's in the 300 million range. So I wouldn't say that the 12 million is critical to the subsidy, but we do need to balance the enterprise fund, and we've had much more need for the enterprise fund to be subsidized based on what we've been doing with the great services that have been provided. So this is just a way to try to balance the budget by using funds that have not been necessary in the last few years because we no longer have children's insurance program.
Sure.
It used to be that this money went directly from the board to family health plan to pay for an insurance project.
Right, I understand that. But just as something, as we're talking about transparency, that I would point out that my staff, who has, you know, really thoroughly scoured the budget, pointed out that in the way that the budget was presented, we weren't shown an $11.9 million fund balance for Children's Health Initiative until this year, when it was shown to be transferred. In the past, at least the past 3 years, all we saw was the annual allocation for it, not the full fund balance. So, you know, hearing the number, that's an issue with I think, I'm not sure what the 4 is, Jeff, 4 years?
No, I was talking to another person.
Oh, sorry.
What you're describing is the fact that we do an incremental budget.
Which makes it very hard to understand the magnitude of this funding. And it may be that, you know, this board with its focus on mental health, on children, on lots of other things, may well have wanted to allocate that funding somewhere else long before there was a thought for you to pull it into the overall BMC or enterprise. I want to use the right term, fund.
Yeah, what you're talking about would be a zero-based budget where you make an assessment every year whether you're going to continue an expenditure or continue a reserve or not. And we haven't done that because of the huge implications that would have for the organization.
Sure.
But this particular action in your current recommended budget is discussed on page 472 of the recommended budget.
Mm-hmm.
And you know, if we want to go to a zero-based budget,
I'm not suggesting that a zero-based budget, but the difference is when it's only incremental, you know the backstory, you know that this fund has been accumulating and has $11.9 million. We and the public don't see that and don't know that. So there has to be, and I don't know what the answer is right now, and we don't need to solve it in this hearing, but we do need to solve for better transparency without presuming a zero-based budget that allows the board and the public to have the same information that OBA does and that you have.
All right, let me take a break there. Anna's been waiting. I think what's very difficult is, what's difficult for me anyway, is we have a budget director, we have our auditor, we have our CEO, and to operate at this line, I'll say line level, with a few million here, a few billion there, when you're talking several billion, that can really, really get tough. But it's making for an interesting discussion, that's for sure. Anna.
Thank you, supervisors. I'm sorry, Supervisor Chavez and Ellenberg for the confusion on this item and perhaps my inability to, clearly convey what we're, that our proposal is not to cut services in any way, shape, or form, but it's really to bring forth, to you, the board, this issue of, transparency and intent, I think, and it's fine, to balance, VMC's budget by pulling, as Dr. Smith said, money in this Healthy Children's Fund that hasn't, been expended for several years. But I think the question for the board, and what we're trying to get to is, are we, first of all, do we have the ability to continue, subsidizing VMC at $12 million or more than $12 million next year for this, same purpose from the general fund, because there's no fund balance to pull from anymore. We're going to expend this entire $12 million. And second, if we do that, if we expend the full $12 million, well, we're not, what is the assurance that, that money is going for expenditures, related to serving children in the community? And that's really, the question here, because, to me, when I see a fund balance of, $12 million sitting in the fund that hasn't been expended, well, that's annual, $3 million annually that should have gone to fund, children's services. It didn't do that. Now it's going to bridge, a funding gap at VMC for, all of the great services that they provide. But are those services, should they be provided, at the expense of services that should be rendered, to kids? That's really the question, I think.
Thank you. And I'm going to interrupt now because I'm going to interrupt now because our meeting's coming up on 2 hours. And I'll turn to the other supervisors in just a minute. But I think this ties into what Vice President Ellenberg brought up in the beginning, was discussion in January about priorities and policies, looking for the budget dollars to go towards, with those dollars that are discretionary and available to us, which we know is about $3 billion out of the $11.5 billion. I think that's a good, healthy discussion to have at mid-year in January. Facts are we're at June 13th right now, and we need to get some things done. So I appreciate all the input we've had from Greg and Cheryl and Jeff and Anna and everybody else. Supervisor Chavez.
Yes, thank you. Just a couple of things that I want to raise. I think one is, thank you, Mike, for reminding us that this is an over an $11 billion budget. I think what this focuses on, though, is both, it's a transparency issue and it's also a need issue. And just a couple of things that I would want to add and just reiterate. I as part of this action, what I would like to do is make sure that we have the TSS discussion, item number 6, coming to FGOC in the fall in anticipation of that November discussion that January discussion that Supervisor Ellenberg would like the board to have. I think that's really smart. I think as it relates to the Children's Health Initiative resource and the tobacco settlement in particular, is that the tobacco settlement discussion, I believe, should go to Children, Family, Seniors Committee prior to the January discussion, because the fact is that we do go back and forth over funding very specific health related issues for children every year. And we have not relied on this fund. As an example, we have looked for money for children to get their eyeglasses at school, for children to get dental services, closing the gap on access. And I think that's a worthy discussion to have. And if it comes to committee, it will be ready for the board to discuss in January. I do think that I also think could be possible is that we ask that as part of the budget that that this fund be the last fund to balance into VMC's budget, meaning that if they don't actually need it this year, that the settlement monies could stay intact to be discussed by the board in the fall. If this money becomes unnecessary, that it's the last tranche of money that VMC gets, so that the board has an opportunity, if it's available, to discuss it as part of the January discussions that Supervisor Ellenberg outlined. And then I would accept the rest of this in the manner that is prepared for us and as the administration sees it on all the other items. So where there's agreement, we keep those intact, and where there's partial agreement, that we go to the administration, except for the two actions that I just requested.
So Supervisor Chavez, I'm taking that as a motion, as
Yes.
my job as meeting manager, and a second by
second it.
Supervisor Lee. If there's not, no, Dr. Smith, your hand raised.
I was just going to say, in conjunction with Supervisor Chavez's request, we can always reassess this at mid-year and tell you at that point whether there's additional revenue in the enterprise fund, which could be utilized.
I'll add that to the motion. Thank you, Dr. Smith, for helping there.
We'll take that yes for an answer. All right, and with that, Colin, roll call vote regarding the motion regarding item number 6. We have no members of the public.
No members of the public to speak. Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Semidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. We now move on to item 7, report from administration related requests for information during the budget hearing. Dr. Smith. Supervisor Chavez, your hand is up. Did you wish to speak?
Actually, this is going to be Greg Aturia, and
Greg?
These are reports back where the board requested information, so we're really just here to give the report and take questions.
Thank you, and I believe that's already in the 136-page report.
Correct.
Okay. Vice President Ellenberg.
Thanks. I have a question or comment just on item 7D. I'm certainly glad to approve the new MRI and CT scanner equipment in this year's capital improvement plan. But I know that our labor partners have expressed some concerns about the diagnostic imaging equipment replacement schedule, and believe that we need a more aggressive replacement schedule due to the age and condition of some of the equipment. I can ask my team to attach their work to public comment for tomorrow's budget hearing for the board and the public to see. And I'm wondering if one of the policy committees, either Health and Hospital or FGOC, might be interested in taking up this item for consideration.
You want that to Dr. Smith, or Dr. Smith has his hand raised?
I would respond
happy to hear
to
from
that.
Dr. Smith, but I'm looking to the chairs of those committees to see if this is something they want to look into with our partners. Dr. Smith?
Yeah, I would say we agree that we should have a faster turnover than we can afford. And this was our attempt at a compromise, but it's certainly a good idea to talk about it in committee because there are implications.
And since it's not my committee, I would defer to Supervisor Lee as the chair of FGOC, or Supervisor Semidian as the chair of Health and Hospitals, to see if either one of them would like that.
Do you both agree? Supervisor Lee, Supervisor Chavez, nod of the head. Supervisor Semidian says yes.
Right.
Thank you. Supervisor Lee says yes. This was a receive report only, but I'll take that as a motion that you just made, Supervisor Ellenberg, because it's an action.
Sure, thank you.
Supervisor Lee, did you wish to second?
Yes, I will.
Thank you very much. We'll go to, nope, we have a comment from Supervisor Chavez.
This may be a bigger comment for this whole section.
Okay.
I see that we have a number of speakers, and I'm wondering if we, because there's a C, D, and E and F, if we want to hear from the speakers first, and then we can take the items.
Yes.
President
Let's do that. It was a receive report only, and it's a motion now. So let's turn to the speakers, call in 1 minute each.
Sure, 1 minute. The next speaker is Mary Gloner. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. I hope you can hear me. So, thank you.
Yes,
I'm
we
Mary
can.
Gloner. I'm Mary Gloner, CEO of Project Safety Net, dedicated to youth mental health suicide prevention in North County, a resident of Vice President Ellenberg's district, and a Racial Equity Action Leadership Coalition member. 2 years ago, in the shadows of George Floyd's death and at the height of the pandemic, this county led the way to magnify and address institutional racism by launching the Office of Diversity, Equity, and Belonging and a Race and Health Disparity Committee Board. The third reinforcing prong to infrastructure and community engagement is to transform county's budget planning to anti-racist and pro-equity. And so I would love you to complete established capital projects such as the youth and patient mental health beds, children and family policy, and public health crisis response to mental health must take precedence to continue the positive momentum championed by the supervisors and preserve community process. Thank you.
Thank you. And I'll remind all the speakers, we have about 20 now, that this item 7 has a motion and a second and appears headed for approval. So if you still wish to speak, go ahead. If you don't wish to speak, please remove yourselves from the queue. Next speaker.
The next speaker is SVCN. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Nick Kawada with Silicon Valley Council of Nonprofits. I'm a member of the Nonprofit Racial Equity Action Leadership Coalition, and our nonprofit community stands in solidarity with the Care First, Jail Last Coalition and continue to believe the county should be investing in prevention, intervention, community-based responses, and behavioral health treatment resources instead of a carceral facility. And while we as co-conveners of the REAL Coalition find much to like in this proposed budget in terms of childcare, behavioral health, and nonprofit sustainability and reentry services, for example, we would also like to see a process for racial equity lens that involves formal structures and community input. And likewise, the coalition again calls for the establishment of civic engagement structures such as a countywide civic engagement policy, participatory budgeting process, and complementary promotorial program. And lastly, speaking with my SVCN only hat on, our organization would like to thank the members of the Office of the County Executive and their staff for working with us to advance the well-being of our nonprofit partners on numerous different fronts. Thank you.
Thank you.
Next speaker is John Pedigo. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And go ahead, John.
Hi, I'm Father John Pedigo from Catholic Charities. I'm the Director for Advocacy and Community Engagement. We're a member also of the REAL Coalition, and we appreciate the movement forward the county has made in addressing racial justice issues. We have 3 recommendations we want to highlight within the overall recommendations: that the county commit a portion of unallocated ARPA funds to backfill city ARPA funds for food distribution. We support the alternative to policing and incarceration. We really do support the Care First non-carceral behavioral health facility. We do not support the building of a new jail. And the third one is we are very interested in the county moving forward for a universal basic income pilot. The county has an opportunity to leverage this work with the Lighthouse Collectivist joint venture Silicon Valley, and we feel that this is something that would really address some of the racial issues through budget consideration. Thank you.
The next speaker is Deborah St. Julian. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
I'm Deb St. Julian. I live in District 2. I'm a member of Surge at Sacred Heart. I'm an actively engaged citizen and taxpayer in Santa Clara County. I'm disappointed with the process of how the budget item for a $689 million jail project was conceived. I'm disappointed that the county executive is submitting a plan for budget approval without adequate community input or paying attention to that input. I am disappointed that over and over again, the county executive sidelines and ignores community input. I hope the board will embrace a truly democratic process. The jail process needs to be collaborative from the beginning and incorporate community feedback. In addition, all aspects of the behavioral health continuum of care have to be robustly funded. This was promised in January, where you're all talking about when you assess things. This was promised, and now we see $1 million for that and $689 million for the jail. Thank you.
Next speaker is Victor Sin. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. My name is Victor Sin with the Asian Law Alliance. I'm a member of the nonprofit Racial Equity Action Leadership Coalition. As a member of the REAL Coalition, we continue to oppose the building of a new jail and believe the money allocated for the building of a new jail would be better spent on additional investments in prevention and intervention and behavioral health and substance abuse care. We also call for building additional meaningful opportunities for democracy and shared power within the county. In REAL's ARP proposals, we asked for funding to be dedicated to a countywide civic engagement plan and staffing infrastructure, as well as piloting complementary promotorial models. Thank you.
Our next speaker is Julia Mangione. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Julia Mangione, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. Our budget represents our values. How can you spend such a significant portion of the capital improvement budget on a jail without a scope or itemized budget, without community input or a community engagement process after all that you have declared and promised? If you listen to your constituents, you wouldn't be funding this jail at all. The money needs to be allocated to addressing the root causes of incarceration.
All right, the next speaker is Yesenia Fernandez. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Yesenia Fernandez with the Latinas Contra Cancer. We are members of the nonprofit Racial Equity Action Leadership Coalition. We believe and stand by the fact that our community needs more investment in behavioral health and substance abuse care. It is evident that a lack of prevention and intervention services is a correlation of homelessness and crime in our county. Additionally, our county desperately needs an increase in funding for families who cannot afford to feed themselves. At LCC, I have seen firsthand how those who are currently going through cancer treatment are affected financially. They struggle with housing, utility bills, and affording groceries. As a resident of Santa Clara County, I must oppose the building of the new jail. As members who serve the public and as an organization whose purpose is to support those in need, it is our obligation to advocate and ask that the committee allocate part of the budget to these services that we know would better serve our fellow community members. Thank you.
Our next speaker is Alima Andrews. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Alima Andrews, and I'm with Latinas Contra Cancer. We are members of the nonprofit Racial Equity Action Leadership Coalition, and as a member of the REAL Coalition, we continue to oppose the building of the new jail and believe that the money allocated for the building of the new jail will be better spent on additional investments in prevention, intervention, behavioral health, and substance abuse care. We appreciate the increase in senior nutrition. We would like to see additional funding for groceries and meals to other community members in need, including those who are unhoused, people with disabilities, and those who are ineligible for CalFresh. We continue to believe that ongoing support for food distribution should be a joint county-city obligation. We also call for building additional meaningful opportunities for democracy and shared power within the community. In REAL's ARP proposals, we ask for funding to be dedicated to a county-wide civic engagement plan and staffing infrastructure, as well as piloting complementary promotorial models. Thank you.
Our next speaker is Catherine Hedges. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. This is Catherine Hedges, a resident of District 2 in Santa Clara County and a member of Showing Up for Racial Justice. I've already mentioned living in downtown and seeing so many people who need mental health treatment, and a lot of people who have probably been in and out of the jails. Supervisors, the jail design process needs to be collaborative from the beginning and incorporate the extensive community feedback received last year, and all aspects of the behavioral health continuum of care must be robustly funded. Address the root causes of incarceration before designing a new jail. Thank you very much.
Our next speaker is Tina Brown. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
This is Tina Brown. I am in support of DBUG and the Care First Jail Never Coalition. And I urge the board to remove the $689 million budget to fund the secure treatment jail for the following reasons. There is a lack of clarity in the total cost to build, which shows financial irresponsibility to the community by the county. The process to build the secure treatment center lacks transparency and is being fast-tracked without public input. The secure treatment center will not treat serious mental illness, it will incarcerate it. The ticket item for the new jail without earmarked funding for a mental health facility or for demolition of main jail and parts of Elmwood reaffirms the county exec's agenda for carceral settings as a priority, not care.
Our next speaker is Rita Giles. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, I'm Rita Giles. I'm a long-term resident of Santa Clara County, District 5, and a member of Bend the Arc, Jewish Action South Bay. We are members of the Care First Coalition and stand in support of DBUG. We urge you to reject funding of the $689 million for the so-called secure treatment center. It would be a jail that would not treat mental illness, but incarcerate it. Inherently, a jail is not a mental health facility and should not be treated as the default mental health treatment facility in our county. Instead, the board should fund the non-carceral standalone mental health facility that the board approved on January 25th. Let's put care first in Santa Clara County. Thank you.
The next speaker is Liz Finney. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
All right. Hi, my name is Liz. Sorry if it's loud. I'm outside by the airplane. I'm a resident of District 2, and I'm here today with for Racial Justice from Sacred Heart. And I just want to reiterate what other folks have already said. A new jail is neither wanted nor needed. And what we need is our Board of Supervisors to be dedicated to their community. We don't need more space to house incarcerated people. We need to use this money to address the root causes of incarceration, including housing, healthcare, mental health services, economic stability via living, thriving wages, childcare, better schools, and expanded community care programs. This jail was a bad idea when we voted on it in January, and it's a bad idea now. Please don't waste my money on a jail that I don't want and that people of my community don't want. Use this opportunity to be better and to do better. Now is the time to do your job and take care of your community. Thank you.
The next speaker is Heather Cleary. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm Heather Cleary, CEO of Peninsula Family Service, and I'm a member of the nonprofit Racial Equity Action Leadership Coalition. We appreciate seeing additional investment in childcare education workforce initiatives. Our children not only need a dedicated, high-quality workforce, but in many cases, their parents need support to create and maintain a stable learning environment for their children. This is one reason we oppose the building of a new jail and believe the money allocated for the building of a new jail would be better spent on additional investments in prevention and intervention in behavioral health and substance abuse. Investments to support family members will support stable learning environments for our children. Thank you.
The next speaker is Emma Hartung. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Emma Hartung. I live in District 2. I work in District 5. I'm a member of Surgeons at Sacred Heart and the Care First Coalition. I just wanted to echo what folks have been saying today, that I've seen just how hard it can be to get significant mental health support here in Santa Clara County, and also have seen just how, I guess, how in my own life, both in and beyond Santa Clara County, how being incarcerated just leaves people further traumatized and with even fewer pathways to support into thriving than they had before. So I'm just really concerned today about how you could be spending 63% of the capital improvement budget on a jail, and really calling to use these funds to address all of the many needs that we have here in Santa Clara County, so that our communities can actually thrive instead of being traumatized and criminalized. And you're hearing a lot from folks today about how many really deep needs we have and how far that money could go elsewhere. Thank you.
The next speaker is Rachel. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm Rachel Krantz. I live in District 5, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. As a therapist who's worked with trauma survivors for over 20 years, I know that people struggling with mental health and addiction issues need a safe place to heal. They also need connection to loved ones, and they need treatment. A safe place, support, and treatment. This is exactly the opposite of what you find in a jail. Supervisors, on January 25th, you voted to build a standalone behavioral health facility under the direction of the county health system, not the Department of Correction. Where is this facility in the current budget? How can you spend 63% of your capital improvement budget on a jail that doesn't have a scope or itemized budget? We urge you to use capital funds to address the root causes of incarceration, instead of fast tracking the old jail design at almost double the cost. Thank you.
Next speaker is Kim Guptill. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Yes, good afternoon. My name is Kim Guptill, and I'm a member of Showing Up for Racial Justice and a proud D4 resident. First of all, I'd like to register my dismay, nay, disgust at the fact that Jeff Smith didn't bother to put the promised behavioral health facility into the proposed budget. Did he really think people who've been advocating for Care First for at least 18 months wouldn't notice? Shame on him. Second, I know you all know the arguments on this subject, and I invite you to imagine a new process, because clearly what we're doing in this country and county is not working. You should listen to the brain trust that is the real coalition, who lead the organizations that care for some of the people that some of you would like to throw in jail. You should also listen to your constituents. And specifically with regard to item 7B, we ask, how can you spend 63% of your capital improvement budget on a jail that doesn't have a scope or itemized budget? I urge you to use capital funds to address the root causes of incarceration instead of fast-tracking the old jail design.
The next speaker is Andrew Siegler. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Andrew Siegler, and I live in District 2, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. I am also a taxpayer, a registered voter, and a recipient of behavioral health services in this county. I'll just get to the point. The community involvement and feedback for the new jail has not happened, and I don't see anything for a standalone behavioral health facility. Supervisors, the jail design process needs to be collaborative from the beginning and incorporate community feedback, and all aspects of the behavioral health continuum of care have to be robustly funded. Please address the root causes of incarceration before designing a new jail. Thank you. I yield my time.
The next speaker is Leslie Zeiger. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, Leslie Zeiger here from Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. Supervisors, how can you spend 63% of your capital improvement budget on a jail that doesn't have a scope or itemized budget? The county exec's vague response to your request in item 7B merely says that 70% of $689 million will be used for construction costs, and the other 30%, it not clear, just other costs. And it doesn't mention anywhere demolition of Main Jail North and parts of Elmwood. Use capital funds to address the root causes of incarceration instead of fast tracking the old jail design at almost double the cost.
The next speaker is Tila Pulliam. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Tila Pulliam, and I live in District 5, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. As an elementary school teacher in the county, I see the impact on children and families from lack of mental health facilities and other community-based alternatives to incarceration. The board first approved a $390 million maximum security jail. Then it morphed into a $689 million secure treatment center without first publicly defining a scope, budget, or project plan. $689 million is a significant increase from the $390 million estimate that the supervisors voted for in January. We were previously told that the cost of renovations would be too high of the jails that are there, but the cost of a new jail is approaching the cost of renovations. How can you spend 63% of the capital improvement budget on a jail that doesn't have a scope or itemized budget? Please use capital funds to address the root causes of incarceration instead. Thank you.
The next speaker is Pancho Guevara. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, supervisors. My name is Pancho Guevara. I'm Executive Director of Sacred Heart Community Service and member of the nonprofit Racial Equity Action Leadership Coalition. There's a lot to welcome in this year's budget: childcare, education, workforce, investments, senior nutrition, and support for investments in EANs and capital needs for organizations like ours in Sunnyvale Community Services. But I also want to echo the chorus of public concerns with the allocation of nearly 2/3 of the capital improvement budget to the new jail without a clear commitment or process for the behavioral health facilities or resources that have been promised. Furthermore, we'd love to see deeper investments in reentry resources and expansion of community-based mental health response systems. But moreover, we'd love for you to continue to look at how to invest resources to be dedicated to ensure that the county budget and policy process can be formally analyzed through a racial equity lens, including expanding civic engagement efforts and staffing. Thank you very much for your consideration.
The next speaker is Jose Valle. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hey, how you doing? This is Jose Valle, the Silicon Valley Debug, Care First, Jail Never. I'm here to for the board, urging the board to reject, delay, remove, do whatever you can to not move forward with the budget of $689 million to build a secure treatment jail until there is until the questions that we submitted earlier in the document, as well as what was submitted, some of the concerns that were submitted in a jail audit that was submitted months earlier. Some of those questions are: there is a lack of clarity in the total cost to build a jail. The secure treatment center it's not going to treat serious mental illness. It's going to incarcerate it. The budget lacks equitable funding for the standalone mental health facility that was voted in parallel with the creation of a new jail in January 2022.
The next speaker is Christine Fitzgerald. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, this is Christine Fitzgerald, community advocate for Silicon Valley Independent Living Center. I couldn't agree more with folks here who are speaking up for racial justice and mental health care. I'd also like to speak on the idea of hiring one full-time staff for the creation or the continued development and creation and implementation of a disability office of Disability Affairs for the County of Santa Clara. This is long needed, very appropriate for what we're talking about here, and so much more. Please take a look at the budget and do hire someone to staff full-time to start and creation of Office of Disability Affairs. Thank you.
The next speaker is Olamide Abiose. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Olamide Abiose, and I work in District 5. And I'm here with the Abolish Stanford as part of the Care First Jail Last Coalition. It's amazing that it looks like things were turning around in the summer of 2020 when this County Board of Supervisors voted unanimously to halt construction of the new jail and invest in community alternatives. And now 2 years later, not only is a new jail being proposed, but its $689 million price tag is over double the amount of the previously rejected jail. As Supervisor Ellenberg pointed out at the January 25th meeting, you can't invest in caging people and mental health treatment at the same time. The county exec has allocated 63% to this new jail, while less than 1/10% is allocated to a non-carceral behavioral health facility. We want the Board of Supervisors literally to put care first by reversing these numbers and grant greater clarity in the total cost to improve the jail and improve the non-carceral behavioral health facility. Thank you.
The next speaker is Jen Meyer. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Jen Meyer speaking on 7B. I'm a D2 voter, a member of SURGE and SEIU 521. Looking at the larger political context outside the county, it's pretty clear that democracy is in jeopardy. So it was very disturbing last November when the unelected county executive's report disregarded community input the county funded. It was doubly so in January when 3 supervisors flat out ignored the wishes of 99% of those writing and calling in. It was triply disturbing last month when the unelected county exec offered a budget that brushed off entirely what you yourselves voted for that day. Supervisors, please take democracy seriously. Supervisor Lee, you claim the county would openly discuss and collaboratively develop a carceral facility that will incorporate feedback from those impacted. Nothing about your decisions has been collaborative, nor have they centered those directly impacted. How can you support a jail bond that doesn't have a scope or itemized budget, use capital funds to incorporate community feedback to fund the behavioral health continuum of care? Thanks.
The next speaker is Andrew Bigelow. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Andrew Bigelow with DBUG. I support families who have loved ones inside Santa Clara County jails. And I want to urge the board to reject the $689 million budget to fund the secure treatment jail. Families showed up to these board meetings saying that a new jail is not what they wanted, and a new jail would not fix the issues that their loved ones face while incarcerated. And since then, the budget has almost doubled in order to build this new jail. $689 million. It's crazy. There's a lack of clarity for how much this jail will end up costing. And we all have to ask the question of how much will it increase from here? How much are we willing to spend to incarcerate? Please listen to the concerns of folks speaking today, and please reject this and remove it from the budget if we can. Thank you.
The next speaker is Sigrid Jacobson. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Sigrid Jacobson. I live in District 4, and I'm a member of Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. Supervisors, in January, 3 of you voted to approve a new jail and a standalone non-carceral behavioral health facility. The public on that day and those who are system impacted clearly asked for non-carceral options, and we asked you as our leaders to put care first. If you now vote to spend 63% of the money allocated for capital projects on a new jail based on an old design and provide only a vague 2-page explanation of where the $689 million number comes from, and then use a euphemistic term to call it a secure treatment facility, it will look like you decided that you know better than the public and that you know better than the very people who are system impacted. I have 3 teen kids at home, and they would be right to name this paternalism. I'm simply appealing to your conscience today to do the right thing.
The next speaker is Josh Markson. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Josh Markson. I'm a resident of District 4, and I'm here with Surge at Sacred Heart today to amplify community concerns with the allocation of $689 million, 63% of the capital improvement budget to build this new jail at double the previous cost estimate. This allocation decision is not the outcome of the collaborative process that was promised, and the fact that such a huge portion of this budget is spent toward this facility and not on behavioral and mental health programs and other community support programs shows that the county is not seriously committed to addressing the root cause of poverty and mass incarceration in our county. I urge the board to reconsider funding this jail.
The next speaker is Rosemary McCarthy. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Oh, hi. I've been an attorney practicing law in this county for 33 years, and I've been a resident of this county much longer than that. And I've seen firsthand that we talked about, I know your frustration in a jail. It's been 14 years, as President Wasserman had said, but Supervisor Otto Lee and you all approved the behavioral treatment center. Judges need choices. Even when a judge makes the choice to send one of our county residents who makes the stand that they are unable to stand trial, don't have the capacity to stand trial, even for something as minor as trespass in a park at night for sleeping, that they order them for competency, but some spend the entire year in jail waiting for a treatment facility to open. We do not have them. Thank you.
The next speaker is Liz Gonzalez. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yes, go ahead.
Yes.
Thank you. I'm District 2, and I'm part of Silicon Valley Debug. We support families with loved ones inside of the jail and have been doing so for many years. We urge the board to reject this excessive and careless budget to fund a deceitful jail, lacking transparency and fast track to continue to harm and rip apart our families. Take the lead from your constituents and spend this budget toward life-affirming services for our communities so that we never need to build another jail. Thank you.
Our next speaker is Louise Arhan. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Louise Arhan from Fortune Partnerships. I want to echo many of the other speakers and urging the board to prioritize alternatives to incarceration, including shifting course to the behavioral health facility that the board had originally requested to build. I think that we all know that our goal is not to incarcerate more people and to increase the jail population, but the current budget doesn't reflect that to the extent that the community needs and to the extent that I think the board wants and intended. So please consider what you can do now to course correct. On another topic, I also want to thank supervisors for including funding for the earlier childhood education workforce, which is badly needed, and urge you as part of that project to collaborate with the early child care home providers, workers, and with the unions to represent them. Thank you.
The next speaker is Ashley Raggio. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Ashley Raggio with Lighthouse at Joint Venture, also a proud resident of District 4. I'm also a member of the nonprofit Racial Equity Action Leadership Coalition. I echo Real's call to oppose the building of a new jail and believe that the rising costs of this new potential jail would be better spent addressing the root causes of incarceration. I believe that counties should focus on prevention, intervention, behavioral health, and substance abuse care, and the priority of these preferred strategies should be non-carceral. I also call for building more opportunities for shared power within the county. In Real's ARPA proposals, we asked for funding to be dedicated to a countywide community engagement plan and staffing infrastructure, as well as piloting complementary promotorial models. We also asked that sufficient resources be dedicated to ensure that county budget and policy processes are formally analyzed through a racial equity lens. Thank you.
Thank you, Colin. Before we go on to the next speaker,
I just want to ask who's ever got their microphone on, if they could go to mute so that we can hear the speakers clearly. Thank you.
The next speaker is William Armeline. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. My name is William Armeline, the director of the HRI and the Human Rights Institute of San Jose State University, and criminal justice chair of the NAACP of San Jose and Silicon Valley, and I'm a member of the Care First Coalition. I'd like to reiterate the concerns of my colleagues, pointing out that there was a lack of clarity in the total cost of the proposed new jail. The proposal lacks equitable funding for the quote standalone mental health facility voted in on January. And we have long since departed from anything resembling a community-led process at this point, as many callers and community members have pointed out. International human rights standards demand that we maximize treatment for those suffering from mental and physical health challenges in our communities while minimizing coercion and restriction for such populations and for those awaiting trial. We've articulated these international standards to the board in writing on several occasions and urged supervisors to live up to their commitments made in 2018 to operate as a quote human rights county. Thank you, and I yield my time.
The next speaker is Stephen Peck. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Stephen Peck with the Behavioral Health Contractors Association of Santa Clara County. Like our fellow members of the Racial Equity Action Leadership Coalition, we believe we need real investment in prevention and intervention in mental health and substance abuse care, not a new jail. Additionally, we wish for more opportunities for collaboration and engagement, which may be more realized in a countywide civic engagement plan, staffing infrastructure, as well as piloting complementary promotora models. Lastly, we do appreciate seeing funding for reentry and would like to see more in that area. Thank you very much.
The next speaker is Lauren Renaud. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Lauren Renaud. I'm with Showing Up for Racial Justice at Sacred Heart and the Care First Coalition. The budget as proposed puts 63% of the capital improvement budget toward a jail. How does this address our mental health crisis? Even if you think this county needs a new jail at some point, was that January vote a blank check? Supervisors promised we are moving toward net fewer beds, and yet the dollars allocated for a new jail have nearly doubled, while proposed demolition is nowhere to be found. And in fact, county staff has proposed using Main Jail North as collateral, which sounds far from demolition to me. We've been told a new jail will be radically different than anything we've seen before, and yet plans were prepared in only 6 months based off of plans that were already 5 years old. We were promised better than this. We've been mocked for pushing Care First and been told that it's not either or, it's both, but this budget does not look like both to us. If the county is really going to address mental and behavioral health, that needs to be prioritized, and the jail can be addressed at another time. Thank you.
The next speaker is Mishi Ellingson. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Hi, this is Mishi Ellingson. I'm a District 3 homeowner, a member of Surge, Showing Up for Racial Justice, and I co-started a Food Not Bombs chapter at Columbus Park. That's a homeless encampment in San Jose. Food Not Bombs does mutual aid, and we have gotten to know the unhoused community at Columbus Park. Many people there have mental health issues. Even so, many of the folks there work multiple jobs. They still can't afford to live. Our society has infinite money for police and jails. Meanwhile, the most vulnerable people in our society are punished by police, attacked in the media, and then locked in cages where they're out of sight. The new American retirement plan is essentially suicide. We need care, not cages. We need mental health services, not a new jail. I yield the remainder of my time. Thank you.
The next speaker is Melissa. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Yeah, Melissa,
Hi.
Go ahead.
Okay, thank you. Hi, my name is Melissa, and I am a system impacted family member and a debug member, part of the Care First Jail Never Coalition. I am in support of Silicon Valley Debug Search and Care First Jail Never Coalition and urge the board to reject the $689 million plus budget to fund the secure treatment jail for the following reasons. There is a lack of clarity in the total cost to build the jail. The secure treatment center will not treat serious mental illness. It will incarcerate it. The budget lacks equitable funding for the standalone mental health facility that was voted in parallel with the creation of a new jail in January 2022. The process to build the secure treatment.
Melissa, are you there?
Yeah, I'm here.
Go ahead.
Go ahead.
Okay, thank you. The ticket item for the new jail without earmarked funding for a mental health facility or for demolition of main jail and parts of Elmwood reaffirms the county's commitment to incarceration and buildings instead of providing services for the community.
The next speaker is Cecilia Chavez. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. My name is Cecilia Chavez, and I am a resident in Santa Clara County, and just want to reiterate everything that has been said earlier regarding building the new jail. There's lack in clarity in the total cost to build the jail. There's there's clear intention in why this is being done, but there's no reason why the public's opinions haven't been taken in consideration for the past months. It's been over a year that we've been talking about the same issue, and we continue to come back to building this new jail instead of continuing to or starting to fund adequate resources that the community is constantly bringing up. We need more resources for mental health rather than a new facility. I yield my time to the rest of the speakers, but please hear us out. Thank you.
Next speaker is Lori Catcher. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Lori, it's giving me an error message that you have an older version of Zoom. You can try to re-log in using a different browser, or you can update in the meanwhile, and I'll try to come back to you. Thank you very much. The next speaker is Javier. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Xavier Espana. I'm with Silicon Valley Debug in support of Care First, Jail Never. I've been supporting one who has been going through mental health court, and I'm just like shocked to see how many of these people are being considered as inmates in the jails that should have never even been arrested in the first place. And to want to build another jail for $700 million, where most of the people that are incarcerated are not even convicted or proven guilty. They're still waiting for the day to prove their innocence, is outrageous. I urge you to not follow through with this new jail and use the budget to really focus on mental health issues and other concerns of the community. Thank you.
The next speaker is Tatiana Foltz. I'm trying one more time. You have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Tatiana Foltz, and I am a proud resident of San Jose, business owner, social worker, and victims advocate. I ask you, I am also a member of Standing Up for Racial Justice at Sacred Heart, who is a coalition of Care First, Jail Never. I ask you to listen to your constituency, to listen to the community members that are directly impacted, and to represent the people you have been sworn in to represent. I do not know much else that this amount of support has been shown up for in the community where our elected officials refuse to listen to them. I know so many victims of crime that will not come forward because they know the system is broken or is fixed against them. Thank you very much.
The next speaker is Lydia. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi there. I don't have a whole lot to say. I'm just listening in, and I understand that this was presented by the Health and hospital, which is an interesting, shady spin, given the fact that they are the ones that put workers on unpaid leave for not granting religious exemption. So anything and everything Health and Hospital wants to present to you, I would definitely question with a big question mark. And I wanted to give you encouragement to be courageous and be empowered. We are praying for you. And just know that there's some shady stuff going on, especially Jeff Smith. Thank you.
I'm going to try to request if Lori Ketcher, if you're still there, please raise your hand if you were able to change your browser or update to a different version of Zoom, and I will then call your name. I see you here again. Let me see if I can grab you here. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, thanks so much for returning to me. I obviously need to do a little upgrading. I appreciate the opportunity to come before you supervisors to speak about the budget that you are going to be voting on. I am a mom of 3 teen to young adult children. I'm a resident of Santa Clara County and the city of San Jose in District 2 for 20 years. I am also a member of Surge at Sacred Heart. I appreciate so much the work that DBUG has done on this for years, and we are here to support them. We are also here to speak as your constituents as well, to say that this budget of capital improvements of $689 million for jail, what if we actually put $689 million to behavioral health? Can you imagine? Can you imagine the wellness that would happen? Can you imagine that we might not need a jail? Can you imagine what it would do for our children who are growing up into whole and...
The next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. And Raj, are you there?
Yeah, can you hear me?
Yes, go right ahead.
Hi, yeah, this is Raj with DBUG and the Care First Coalition, calling on the board to remove the jail project from the capital improvement plan because it's such a massive departure, not only from the public call to move away from incarceration, but also the board vote itself in January. Namely, the board approved the jail as conditional to the simultaneous building of a standalone mental health facility. Supervisor Lee even put it out in a newsletter after the fact to justify his jail vote confirming this. But this budget has barely anything for this mental health facility. It only has a jail that is now nearly double the cost without any explanation. It's also irrational to go ahead with a jail in terms of implication of size, scope, and need without an understanding what an impact of a mental health facility would have on those key issues. Secondly, this county has had an audit done of the proposed jail design and listed a number of basic questions, such as articulating who this jail serves, how, and explanation of the budget. The CEO office still hasn't responded to these questions. Given this lack of transparency, the unilateral way the CEO is moving, we urge you to reject this jail.
The next speaker is Sammy Evans. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm the Reverend Sammy Evans, and I live in District 6. I am a member of PAC's beloved community, and I served on the city's Reimagining Public Safety Committee. I'm speaking today on behalf of myself and the Care First Coalition. I'm also speaking as a person who has witnessed firsthand the cruelty of our jail system. I've experienced immeasurable trauma and loss as a result of our unjust and ineffective carceral system in Santa Clara County. My own experience disrupted not only my own life and career, but also the communities that I serve and belong to. I am asking y'all to listen to the stories of those who are directly impacted and to choose people and care over profit and corporations. Jails don't make us safer. A militarized police force does not make us safer. Criminalizing poverty does not make us safer. Communal care, compassion, and equitably distributed resources can and will make us safer. I urge you today, put care first. We don't need a new jail. We need a community that centers care for the orphan and the widow.
The next speaker is Sharice Domingo. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
My name is Sharice Domingo and I'm with DBUG. We may never agree about whether society needs incarceration or not, but I hope what we can agree on is that there's not enough transparency about this jail that the county executive's office is proposing to build. There's no public design, scope, or budget. The county auditor completed a report in January of 2022 about the jail, and that report was largely ignored, just like our 2-year community engagement process. However, why it's critical now is that those same questions the county auditor posed in January about the jail still stand. And the risk is higher now because you're considering spending $689 million for the jail and then another $40 million a year for debt service. In addition, when the decision to move away from the jail was made by the board in November of 2020, it was to address mental health. But creating this jail goes back to the problem that we tried to get away from to begin with. I urge the board to delay the jail budget item until the item can be fully and publicly deliberated. Thank you.
The next speaker is Tamara Hall. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Tamara Hall, and I'm a member of the Racial Equity and Community Safety Committee at Sacred Heart, as well as the Care First Coalition. When it comes to jails, and specifically here in Santa Clara County, I am completely against it. As many people have already said, we don't need a new jail. We need investment in alternatives and mental health services and supports in our communities. I urge you all to delay this and think more about what the community is asking for and what the community needs, specifically people of color. For myself, I'm a Black and Mexican woman in Santa Clara County. I'm a teacher as well, and I'm concerned for our youth. I'm concerned for the school to prison pipeline. And when we invest in jails, we're technically investing in prisons instead of in the community and in education and in our future. So please do not pass a new jail and think about what we need for our future and our.
The next speaker is Alicia Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Alicia Chavez. I am an organizer with Silicon Valley DBUG and a constituent of District 3. I am here to support and echo everybody else's request to reject the $689 million budget to fund a secure treatment jail. And I just wanted to point out, a secure treatment facility is also what the county has decided to call our new youth prison in Santa Clara County. There is no treatment being held that is going to be held in either of these facilities. And I just wanted to make sure that everybody knew that as well. This process has not been transparent. There has been a lack of clarity in the total cost to build this jail. And the secure treatment center will not treat seriously mental illness, but incarcerate it. The process.
And that concludes our request to speak.
Thank you very much. Colin, I see a hand raised by Supervisor Chavez.
Oh, thank you. I didn't know if the staff, I had only raised my hand to make sure we heard public comment, but I didn't know if the staff wanted to present on the letters. I mean, on the letters that of response or where we were on the agenda. So could you catch me back up, Mike?
Sure, we're on item 7. We have the various attachments. Staff was there. Like I said, they had a 130-some page report and a summary of items 1 through 19.
Great, and I will go ahead and get started. And perhaps I'll start with the first item that that the staff gave us relative to the issue of debt service. And on the report, and I apologize that I've now lost my page, but on the report relative to debt service, there was an acknowledgement that there would be about a $40 million availability for debt service. And what I wanted to just better understand from Greg, if you could just help us understand the total amount of debt service available. I talked about that earlier, not relative to what was lawful, but relative to what our overall budget is. And whether or not, and I apologize because I really can't find my letter. I think you had a $40 million number. And what I didn't know was that 40 million, would that be inclusive of a new jail? Or is
Yes,
that in addition?
Yes,
okay.
that's
Yeah.
basically the number on the jail, correct, Greg?
Yeah, that's correct, President Wasserman. So 40
Yes.
million is the current estimated annual debt service for the new jail project.
So if that 40 million, using that 40 million number, the amount available for debt service to build, for example, other facilities, would be then what would be left?
Well, anything that would be new projects beyond that, it would depend on of course, on the cost of that project and how much was financed, and we would be able to, provide an estimate for what that amount. But you could prorate it. You could take the 689 million, and divide it by that 40 million, to get a rough amount. If we want to help with an exercise there, but it would depend on how much is financed.
Understanding that, what my question is what is the annualized cost of so if we anticipate for the jail that the what would is the annual investment $40 million?
Yeah, the annual investment would be for the debt service would be 40 million per year for the duration of the financing period.
Got it. And so what room is available for additional debt service for other projects that are not yet scoped with a finance amount? Is it another 30? Is it another 50? And just to say out loud, the debt service gets paid by our general fund annually. So this would be $40 million we're spending out of our general fund for debt service for the jail. And if we wanted to build other facilities, we anticipate that we could spend another 30 a year, what would the amount be based on the projections that you have in the budget going forward?
Greg, if I may step in for just a minute, I know the 40 million a year is the debt service on the bonds issued to fund the jail. Supervisor Chavez, is your question, what if the county wanted to build 5 or 6 other buildings elsewhere? What debt service could we sustain?
That's right. Thank you for saying it better, Mike. That's what I'm asking, is that what we could sustain?
Yeah, of course, that's a relevant question because it competes against the cost for other services and supplies, cost of labor, and also depends on what the changes are to our revenues. As I mentioned in the opening of this meeting, we want to be mindful of what our potential changes in property tax revenues and other revenues are over the horizon. So it's not something you can really calculate. It's just, it would be an additional cost in the future to borrow for, additional projects in the future.
So we have had a discussion about making sure that we could finance the construction of a jail. And we told the public that there is room to finance construction of other needed services, including mental health services and drug and alcohol services, and IMD beds and other facilities like that. I know there are different mechanisms for funding as well, but what I'm trying to understand is, as we move forward with the construction of a jail, what essentially is left for us to consider for these other facilities that we know we need? And I'm presuming that the 40 million for the jail, we recognize that we have that, and that we're going to fund the child and adult psychiatric facility at VMC. So essentially, as you all are thinking about as we move forward, what is the capacity?
Let me try to jump in and answer that. There's no fixed amount of money anticipated in the future for paying off debt service. However, it's important to recognize that there's multifactorial issues related to your question. One is, how much is the project going to cost? One is, how much do we sell bonds for? And the other is, how much cash we use to pay for construction. The 600+ million that we're talking about with regard to the jail is only from lease revenue bonds. It's not money that we have in cash. It doesn't exist in our treasury. It can't be put into any services. It's only going to be apparent if we sell bonds to build a structure. If we were going to build, as we are going to build IMDs, we would envision larger proportion of that expenditure coming directly from cash, because we could do that in pieces rather than a jail, and an IMD doesn't require as much infrastructure as a jail because of the security issues. So we're very confident we'll be able to build IMDs and also build a psych hospital expansion in the future.
Thank you.
So Dr. Smith, let me just revisit that question for a moment. Thank you. Just to make sure I understand that, but as we're planning into the future, I imagine that we recognize that $40 million debt service payment will come out of our cash flow, right?
It'll come out of the general fund, yes.
That's okay. So I just wanted to be clear about that. And the point
Which is
you raised,
about $3 billion.
ultimately.
The general fund every year is about $3 billion.
No, I understand that. What I'm asking is though, do we, as you all are planning into the future, since we've had a discussion a little bit earlier about, cost escalation and all of that, what I'm wondering is what capacity do you believe that we have in the budget overall for the other services that we're talking about? And if your point is that we won't be using debt service for all of them, which I readily accept that the difference between the jail and, for example, something, other big and significant projects that can't be built in pieces, including the psychiatric hospital, what are you planning for in future budgets for the money available to address those other needs, given that the projects would only be in planning this year and come online much later?
Well, I can't give you an exact number, but I can tell you that the difference between building a jail and a psych facility or IMDs is that IMDs and psych facilities come with a built-in revenue source, an additional revenue source compared to what our current revenue is, because you're billing for the service that you're providing for the patient and it's reimbursed by Medi-Cal, Medicare. So that's a way of defraying the cost. And generally, we have the ability to bring down supplemental payments, and we're going to have the ability to bring down payments from CalAIM and the behavioral health facilities applications, which are ongoing. So there's much more money available for building psych facilities and IMDs than there is for building jails. So we could, have, it depends on how big you want to build it and how big the IMDs are, but I'm confident we could deal with anything that we need.
Awesome.
Thank you. Thank you for that information. I'm going to let Supervisor Ellenberg jump in. Thank you.
Vice President Ellenberg, did you want to talk on this subject or another matter?
Yeah, this subject is fine. And Dr. Smith, I hear and appreciate your comments about the building of mental health facilities. I'm of course thinking also of the inpatient psychiatric hospital that Supervisor Simidian led on 8 years ago, and construction hasn't begun there. What I want to say is that I believe that it is premature to include proposed revenue from a jail bond measure that the board has not approved in the budget right now. My own opinion remains that such new construction should not be our foremost priority, particularly considering really urgent facility inadequacies, such as the absolute dearth of a sufficient continuum of essential services for the treatment of mental illness and substance use disorders. I very much appreciate that the board is going to take up a conversation around prioritization of capital projects in September. I'm aware that we cannot do everything at once, and certainly we don't have unlimited capacity to take on debt. The jail debt, as I think Supervisor Chavez was getting at with her questions, is inevitably going to limit the programs and services that we can provide to our residents. Dr. Smith, I appreciated hearing about the potential revenue measures from mental health facilities. Of course, investment in a jail is going to draw zero revenue, which is why the $40 million a year in debt service will need to be repaid from general funds, whereas mental health facilities could draw revenue from commercial and public insurance providers that will reduce the repayment of our general fund. So I strongly believe that we really shouldn't approve a budget that presumes that a jail will come first when our prioritization conversation is really just 3 months away. And I absolutely know that there's concern among some about delaying the construction of the jail. I want to point out that the debt servicing payments that are included in this budget are just $7 million for 2022 on a projected $40 million annual costs, which really suggests that the county is not even going to issue the debt until October at the very earliest. And again, pending board approval. So I think that we have time to talk in September without incurring a delay in a potential bond issuance of more than a couple of months. I also want to make the point that the off-agenda report from administration from May 6th, 2022, titled Secure Treatment Center Cost Estimates and Related Debt Issuance, notes that a budget request for debt service payments may be issued at mid-year. So I'd like to offer that report as some strong evidence that the jail bond really does not need to be included in the budget at this time. Thinking long-term also, I certainly hope to be on this board for another 8 years, Supervisor Lee, perhaps for a decade. And before we're saddling ourselves with $40 million in annual debt that has to come from the general fund, I want to know that we've considered every other capital expenditure that might provide greater and much more urgent value to a broader array of our residents. In addition to the $7 million budgeted for the first 2 months of anticipated debt service, the budget also includes just under $10 million to prepay prematurely or early pay off the current debt on Main Jail North. And presumably that prepayment is being made to clear title on Main North so that it can be recollateralized for the new jail. That 9-point-something million also ties up funds that could be allocated to more urgent purposes. And again, it feels premature to me. I am well aware that our 3 existing jails are in poor condition, but county IMDs are non-existent. EPS and Barbara Aaron's Pavilion are also in poor condition and are backed up with people who can't move to subacute facilities, and the county is paying dearly, again with general funds, when people are languishing in BAP beyond their covered stays. I also want to note that Care Court is going to be approved in the legislature's fiscal 23 budget, and counties are going to assume an even larger responsibility for providing mental illness treatment facilities when judges direct people to them. And as the bill stands now, counties are going to face daily sanctions for failure to provide these services. And by focusing on the jail first, I'm concerned that we're going to walk ourselves into crippling financial burdens, that we won't have the bandwidth or funds to adequately address our significant mental health crises, and thousands of county residents, as well as their loved ones, are going to suffer. So what I would like to do at this time is offer the following motion and then ask respectfully for a second. My motion is that we withhold the $689 million in funding for the jail from the capital improvement plan, as well as the matching revenue, and place the $7 million in anticipated debt service for the jail and the $10 million in early debt payment on Main Jail North in a new reserve for board-directed capital projects to be directed and utilized after the board's prioritization conversation in September.
And I'm happy to second that.
Thank you.
All right, we have a motion and a second. First, I'll turn to Mr. Williams, and I've got some comments of my own, and then any other supervisors that wish to raise their hand. Mr. Williams.
I just want to note this motion would be in proper order under item 26 on the agenda. Item 7,
so
which I think we're still on, is just a receive report related to these informational reports.
James, I actually had the talking points that I just offered under 25 and 26, but since so many of the callers were talking about the jail and Supervisor Chavez was making such useful observations and asking questions about the debt issues that I thought I would put it here, but I'm happy to either hold that or if it's the president's will, if we could bring 25 and 26 into this conversation, and I would make the motion on those items if that's the appropriate place.
Thank you, James. I appreciate what you said. Supervisor Ellenberg, I appreciate what you said. The speaker spoke on this item, which was actually 25 and 26, like you said. So instead of getting all clustered up in 25 and 26, why don't we deal with this item right now? For myself, I will not be supporting the motion. I think we've gone down this. I'm sorry, Vice President.
I just want to note, you want to hear 25 and 26 later and separately and have the conversation again?
No, I don't want to have.
If I can make a suggestion, President Wasserman, I would suggest that the board go ahead and vote on item 7, which is just to receive reports. And then the board could immediately move into 25 and 26, take up this motion.
Fine, that's clear.
And return back in order. I think that would be a way of dealing with it at this time, but while still being within the scope of the appropriate items.
Thank you, County Council. I appreciate your guidance. All right. So the motion is on hold at the moment. We've got this item number 7. And I see Supervisor Lee, your hand raised. 7 is to receive the reports, which we've certainly done. Supervisor Lee, your hand is raised, but I can't hear you. You're muted.
Yes, I want to talk about 7I regarding the fluoridation issue, actually.
All righty, fluoridation.
Yes, looking at the map of fluoridation, it was interesting to note that half of Sunnyvale and quite a few cities in our county does not get fluoride, including like Cupertino, Campbell, even Los Altos, and quite a few places. So I just want to see if I can get off the general report from staff regarding when these might actually be implemented or what the plan might be in the future.
Staff.
Sure, we can get you a report. This has been one of those struggles that's been going on. I know the board knows this for quite some time, but just for the public's information, the problem that we have in this county is that a large portion of the county is supplied by wells, and in order to fluoridate them, you need a fluoridation process at each well site, which is quite difficult to do. But we will get you a up-to-date rendition of that from public health and environmental health.
Thank you.
Thank you. Did we have a motion, not including Supervisor Ellenberg's? Did we have a motion on item 7? Otherwise, it's to receive the reports received. Oh, Supervisor Chavez, I see your hand.
Thank you. And I'm after I make a few, just ask a few questions, I'm happy to make a receive report motion. Just a few things that I wanted to affirm on item. So first of all, I wanted to thank the staff for all the letters. They were very, very informative. On item 5E, I wanted to request that the staff come to Children's Family Seniors Committee with a staffing report and structure and how they're going to be doing an integrated work plan with the entire Department of Division of Equity and Social Justice, and also the inclusion of that for disability affairs to Children's Family Seniors in the first quarter of the year. I think that would help kind of dive into issues that will be important for us to address, so that the work plan is more clear, and also its capacity. I think we're putting a lot on it right now.
I'm sorry, Supervisor, what item was that you were talking about?
That's
7?
5E. Oh, I'm sorry, it's under 7, but it's labeled 5E on the chart, the request for information that you gave us. So it's number 3. That's actually an easier way to look at it. That it's number 3.
Staffing plan for community engagement.
Well, it's a
Okay.
staffing plan for, yes, that, and also just overall the Division of Equity and Social Justice, now that it has so many components to it.
Okay, I got it. I was just trying to clarify, sorry.
Yeah, and no problem. And I'll use the number on the numbers on the left-hand side, the furthest left. And then the other item is on item 6. This was Supervisor Lee's question about whether or not we could use ARPA or FEMA money for VITA 2. I just wanted to put on the record that they are funded this next year through general fund, and just not to, as people are listening, not to frighten anybody that they're not funded. Item number 7 is the timeline for the Trauma Recovery Center. I'm really excited about this program. Wanted to really acknowledge the good staff work that went into it, and just to make sure that as we're looking at stakeholder input, that you reach out to the board offices, because I think all of us have been contacted by people who've been victims of crime or who are experiencing trauma from one experience or another, that we might be able to offer some good feedback there, or some folks for feedback. Item number 11, and this is a public health department's, the door-to-door outreach. I just wanted to say thank you for that one. On the item number 16, this is the site mitigation program. And Dr. Smith, I wanted to bring your attention to this because the staff is letting us know that this is a 3-year program that will end in 2026. And this is a really important partner to getting land ready to have affordable housing built upon it, or housing at all. And 2 things that I'd be interested in. 1, I would like to have staff come back to us as to whether or not we should be lobbying the state to extend that program. And 2, I am very concerned that if we're not accepting any more clients, that it's going to slow the pipeline down and make less land available for housing. And so what I'd like to request is that this be heard by either FGOC or Hewlett, whichever the staff thinks is appropriate, early this year, because I am very nervous about this choking off housing opportunities pretty dramatically.
Yeah, I think we should bring it back to Hewlett if that's okay with the board.
Yeah. Mike, is that okay with you? That's
Yep.
your, okay, thank you. And then, there was one that I missed. Oh, and this has to do with the VASC. I had asked and have not yet had the staff plan come back to Children's Family and Seniors Committee with the staffing plan and a strategy for implementing services. And one of the biggest challenges here is that I believe we need a senior executive to run the VASC. The ESA did a study that said that it doesn't need to be a senior level person, but a PM3. I'd like to have that discussion come back to Children's Family Seniors to review the study to better understand why that's the case, because frankly, it concerns me. It concerns me overall. So if we can get that back to us in August at Children's Family Seniors would be ideal, and make sure that we get the staffing plan at the same time. And just to put on the record, there's no decrease in the budget. It looks like there is, but we're actually maintaining funding for the VASC. So anybody who's listening, there's no harm will come to the VASC. I think those are all my comments. So with that, I'd like to move that we receive the report with comments from colleagues in terms of next steps for the areas that were covered.
Thank you. And I'm going to ask Vice President Ellenberg if there was a motion earlier between her and Supervisor Lee seconding regarding a request to FGOC and Health and Hospital.
Oh, that does sound familiar. Yes.
Okay. We have that information from the clerk. So Supervisor Chavez, I'd like to combine your motion with the prior one of Supervisor Ellenberg and Lee, if you could be a friendly amendment.
I am happy to incorporate that. Yes.
Thank you. Supervisor Lee, you're shaking your head. Yes. All right. So we have that in place. Any other supervisors wishing to say anything at this time? And then we will move from here and hear 25 and 26 together, which we just heard from speakers on. Seeing none, call and roll call vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Smidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. And with that, we're going to move to 25 and 26. Hearing them together makes sense. Thank you, Mr. Williams, for that suggestion. I'll continue my comments, then conclude and look for any other supervisors that wish to make comments. I have said from the beginning, we need a jail, new jail, we need a new public health facility, a mental health facility. I still believe that's true. Deferring the jail will not make it any less expensive or change how it's financed. Building the mental health facilities can happen too. The design can start now. The effort can start now. Dr. Smith has already said how those receive reimbursements, how they're less costly. Procrastinating on a jail, in my opinion, does not make it less costly. Every 3 to 4 years when this has come up, the number has been lower. I'm going to be opposed to the motion because I think we need to build that jail now, and we need to start designing a new mental health facility. And I will stop there. Supervisor Lee.
Thank you, President Wasserman. So I have some questions for staff regarding the behavioral health facility as well. So right now there's a budget item to start the planning for the standalone behavioral health facility. What is the actual timeline regarding the planning process of this at this point? And is this about what, $1 million? Is it really enough to plan? And I just want to make sure that we're going at full speed ahead on this one.
Yes, we're going to have to do a scoping session with the board after we get back from the break. There are a few decisions that need to be made by the board in terms of scoping. We need to first think about where do we want to have the facility. There had been some talk about having it at Elmwood. It would be a hospital, so a better location might be on the VMC campus,
right,
which would then require us to pick a great place on the VMC campus, something like the Don Lone Pavilion area or the BAP area, or there are other areas which could be considered. So we'll have to bring back decision points about that for the board to talk to us about and give us policy direction. There'd also need to be some idea of the size of the facility and the number of beds. We'll come back and give a recommendation. The board will finally decide. And, you know, at that point, we can give an estimate of cost and revenue based on those factors that would give the board something to discuss and give us direction. Once we have that, we can move full speed ahead with all of the design and planning issues that would need to be done to get it done. So we'll move full speed ahead, and we'll see you back in the late summer to talk about scoping and other issues.
So we're having our break in July. So you're thinking that this will come back to us around August, September timeframe?
I think September at this point.
Okay. And that you do believe that being a VMC campus is actually doable, so we don't have to deal with Elmwood altogether, right?
Well, not being a construction specialist myself, I think it probably is doable. Of course, I can feel FAF cringing right now because we have so many projects going on the VMC campus.
Mm-hmm.
But we clearly have some space available, and you know, since we're going to consolidate into the new psych building, some of the emergency services, I'm sure we could move things around to free up space. Again, it depends a little bit on, well, a lot of it on how big you want it and the design, but those will be things that we'll have to discuss. If we're going to have a psych hospital, I would argue against putting it at Elmwood because it's really a hospital rather than a jail.
Mm-hmm.
And then there's the other possibility of, well, I shouldn't mention that, forget it. Other land that we have that could possibly be utilized. We have 2 other hospitals that have land around them.
Okay. No, I certainly agree with you that if we could put it in the BMC campus, by far would be much better being a health facility, which is what we're building and not another jail. This is what we're trying to avoid, because not being a carceral, not a non-carceral facility. And this will be something that in the range of hundreds of millions of dollars approximately, right? Well, obviously, we don't know how much it is, but it's something going to be about that range, because using the adolescent psych facility that we're currently building, that one's already close to what, over 500 million, correct?
Right. That's more complex than I think what the board would envision. But yes, that would be in the hundreds of millions of dollars. And again, we would fund it through lease revenue bonds and a combination of anticipated revenue from medical care and from specialty funds from behavioral health.
Okay, great. Then the other questions are relating to the cost estimate of the replacement jail. Currently, it's stated at 689 million, which is 300 million more than the original estimate, right? And the report says that's partly due to the 25K square foot for the infirmary, and also the intake booking area, and also due to inflation as well. Is there a way we could kind of break down a little bit more of understanding which part is from inflation, which part is for adding these areas?
Sure, we can give you an idea. Most of it is actually from inflation, but we did make the suggestion that if we're going to tear down north, which we will, that we want to have booking and some additional space in the new building. And just to sort of add in, there was a discussion during the public comment about using Main Jail North as collateral and what that implication is. That's only until we actually build the new structure. Once we build the new structure, we transfer the collateral to the new structure, and therefore the Main Jail North is free and clear and can be torn down.
Okay, all right. In terms of the outreach, there's been a lot of complaints about not having enough outreach of the replacement jail while we approve these funding. When will we be able to see some drawings of the draft design and any type of outreach we're going to be able to make in terms of gathering public input?
You should get those in the fall.
Around September timeframe?
Yes.
Okay. And the idea is that we're going to take comments from the public, and we're going to go through the various hearings that like we did previously, right? Regarding the public on what type of facilities and space and et cetera, correct?
Right. And the board obviously has the opportunity to change plans or make modifications.
Great. And then, of course, if we were to build a small facility instead of 500, like less number of beds, the cost could probably be lower too, correct?
That's a question I don't think I can answer with expertise, because much of the cost is built into just the fact that you're building a new structure with all the reinforcements, whether you have more or less cells. It affects the cost, but I can't say that it affects it dramatically.
Okay. Now, how about the demolition of Main Jail North? Because the idea is that once the replacement facility is being built, then Main Jail North will be demolished, since we will have no need of it whatsoever, because we are not adding new beds. We are replacing it with less numbers, actually. So in terms of timing, what would you say would be the timing for demolition? Would that be able to happen, say, within 3 to 6 months of the completion of the replacement jail?
Once we have full occupancy of the replacement facility, then we would move ahead with contracting to demolish it. 3 to 6 months might be pushing it, but it would be empty the minute we move everybody into the new facility. So we would have to do hazardous abatement, because it's pretty likely there's some hazardous material there, asbestos or other things. And we would also have to clean out some of the gel cells and other things that need to be taken out before we can demolish it, just like we did with Main Jail South.
Right. And right now, the Main Jail North capacity is about what, over 800, isn't it?
Right.
Okay.
So we're planning on, decreasing the number of beds in the central, number of cells in the civic center area. And once we can do that, we can also decrease the number of cells in the Elmwood area. We already have plans for demolishing the barracks, which are minimally used and old and are in disrepair, but some of the other buildings will also be demolished once we can move the inmates around.
Okay.
So I think, the goal, my personal goal is no more than 2,000. Obviously, that doesn't depend exclusively on us. It depends on the courts and a lot of other issues, but I figure if the smaller we make it, the replacement, the more likely we are to be able to provide the services and avoid over incarceration.
Right. I talked about the decommissioning of Elmwood altogether previously. or at least reducing it. You talk about demolishing the barracks, but if we talk about so how many of those have we already decided at this point to eliminate in Elmwood? I believe the number is closer to like over 1,000 that beds that would be going away.
You mean compared to full capacity?
Yeah, compared to where we are now.
Yeah. Yes.
Okay.
Correct.
Okay, thank you.
And with regard to Elmwood, right now there's minimal camp and medium camp. They don't call it that. They call it intermediate. But if we could empty out as much of minimal camp as possible, that would be a great step forward. And also we have the women incarcerated in Elmwood, and it's really relatively small numbers. So we're looking for ways to avoid that. Well, it's probably not fair to say most, but a lot of the women who are incarcerated are for non-violent offenses, which we feel that the courts and the public defender and DA could work on significantly to release with other less restrictive locations.
Okay. We talk a lot about the various ways of doing alternative incarceration, and I spoke about the issue of a deflection center. Have we made any progress on that idea, and whether this will be something that we'll be incorporating soon?
The deflection center concept was one of combining EPS style issues plus social services plus security services, and we've been looking at other facilities nearby. There was and still is some discussion about possibly being able to modify the current reentry center to be sufficient. I think that might be pretty hard to do, so we're still looking for space where we could do that with adequate services. So I can't tell you, for example, exactly where it would be, but we probably need some significantly more larger space than the reentry center.
Do you think this could also come back the same time around September, and we could have a more holistic discussion on all these?
We can do that.
Okay. Thank you. Okay, thanks. That's all the questions I have.
Thank you, Supervisor Lee. All righty, we have a motion on the floor. We now have 10 speakers electronically registered to speak on items 25 and 26. But if they spoke about the jails previously, they cannot speak about the jails now. So
this is the clerk.
Yes,
Looking
Colin.
through, I believe all except one spoke on the previous item.
Okay, thank you. So I want to allow anyone wishing to speak on this item, except for jails, if they didn't speak before, to be heard at this time. And I appreciate the clerks keeping a list of who has spoken so that we give everybody equal amount of time and we don't have duplication taking place. So Colin, if you could please allow the speaker that did not speak before to speak now. And
Sure.
then we have a motion on the floor by Vice President Ellenberg that was seconded by Supervisor Chavez that we will take a roll call vote for. And then we will see if there's anything else on 25 and 26 that administration has asked for our direction.
All right, the next speaker is Lanny. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak, and the timer will start when you begin speaking.
Hi, my name is Lonnie Ballard, I'm a member of Showing Up for Racial Justice and the Care First Coalition. And I've just listened to a lot of promises, and I'm not sure what I can believe or what's going to happen in September. But I just like to say I live in a district, in District 1, in a usually quiet neighborhood, but it does have its share of problems. Community safety is a concern for myself and my neighbors. I'm a believer that addressing issues before they escalate is imperative. That's why I think behavioral health services for all ages that the community can access is so important. Can we put a significant portion of our budget into prevention of criminal enterprise through community care? We urge the board to put care first. Don't approve the budget until the capital improvement plan prioritizes the non-carceral behavioral health center.
And that concludes our request to speak for speakers who are new to the queue.
Thank you very much. And let's see, we had a motion, we had a second. Call and roll call vote, please.
Supervisor Lee,
No.
Supervisor Chavez,
Yes.
Supervisor Simidian,
No.
Vice President Ellenberg,
Yes.
and President Wasserman.
No.
So that
All right.
is 3 no's to 2 yeses.
Thank you. Let's do the rest of the action required of us on 25 and 26 at this time. And then we'll move on to the other items. Then I will talk to the board about dinner breaks and things like that that we need to look at. So on 25, it was considered the county executive's fiscal year 22-23 revised recommendations for the facility and fleets department relating to the creation of capital projects. Possible actions is to establish a countywide public art capital project, and B, allocate $750 from the accumulated capital outlay fund, and C, refer the item for final consideration and approval on June 16th. Does anyone wish to make a motion? Otherwise, I'll be happy to. Supervisor Chavez.
Thank you. Supervisor Wasserman, as you make the motion, could you either split the motion so that the financing for the jail can go as one? Or if you make a full motion, I would ask James if we vote yes, but with no for the financing for the new jail at this time.
Sure, I think the second way is possible. Let's make sure with James. James?
So as I understand, item number 25 doesn't implicate in any way the funding related to the jail. So I think 25 could just be voted on as standalone.
And then we can do what she suggested on 26?
On 26, it's embedded as a subcomponent for referring it to final consideration. So I'm not sure exactly what the intent.
So James, similar, and Supervisor Chavez, correct me if I'm wrong, but similar when we approve the consent calendar, but we say we want to register a no for item 71. I believe Supervisor Chavez is saying she wants to say yes for this, but not for the funding part for the jail.
Not for the debt issuance. That's correct.
Debt issuance, and that would come under 26.
Yes, that's embedded in item number 26.
And because we were taking them both together, James, that I thought that's what was going on. So that's what I was asking.
Understood. The vote now is on 25, Supervisor Chavez.
Okay, then I'll move approval of item 25.
I'm happy to second. Vice President Ellenberg, you have your hand raised.
It was a question about 26. James just said reference the debt issuance. Are we actually approving issuance of the debt today? That doesn't have to come back to the board again? I just want clarification.
James, go ahead about June 16th.
Yeah, item number 26 refers for final approval on June 16th. The appropriation related to the jail, it doesn't approve the actual issuance of debt. That's a subsequent action that the board would need to take as a separate item altogether, apart from the budget.
Okay, thanks, James.
And
Thank
we,
you. And so I would be asking for the separation of the appropriation.
okay, so, but let's do 25 right now. Motion by Chavez, second by Wasserman. I'm going to call for a roll call vote, please, on 25, which has nothing to do with the issuance of the debt.
Supervisor Lee,
Aye.
Supervisor Chavez,
Yes.
Supervisor Semidion,
Aye.
Vice President Ellenberg,
Yes.
and President Wasserman.
Yes, thank you
Thank
for that. Thank you, yes, thank you. So James, we're now moving on to 26. If we want to register, if Supervisor Chavez wishes to say yes to everything, but no to any issuance of debt.
Or no to the appropriation for what I think is the jail. It's called the Secure Treatment Center, but I think it's a jail. So I would, yes, that would be my
Okay.
preference.
So you would be a motion to approve, but not the appropriation portion.
Correct.
Okay, thank you. Do you wish to make that motion?
I don't think I can if I'm voting no on part of it. So
Okay, I'll be happy to make the motion for approval on item number 26.
Can I clarify
Yes, Dr. Smith, you're in a tunnel.
a little bit,
There we go.
Supervisor? From what I understand, the motion would have to be the approval of the recommended staff action, and the two supervisors who were opposed to the allocation would indicate a negative vote for that component of the recommendation.
yes,
Thank you. Vice President Ellenberg, does that satisfy you as well?
What will that mean in terms of the budget items? Do they need 4 votes or 3 votes? To
James?
pass?
Only 3 votes are required for the budget.
Got it. Thank you. Yes, that's clear.
Okay, then that is my motion as stated by Dr. Smith. Do I have a second for that motion?
I'll second.
Thank you, Supervisor Lee. Is there any discussion, comments? I don't see any hands raised. Colin, roll call vote, please.
Supervisor Lee,
Aye.
Supervisor Chavez,
yes, but not on the appropriation for the jail.
Supervisor Semidion,
Aye.
Vice President Ellenberg,
Yes, but not on the appropriation for the jail.
and President Wasserman.
Yes.
Thank you.
Thank you. With that, Colin, I believe we return to number 9.
That will be, let me take a look here. Did we get number 8?
No, excuse me, that the previous one was on 7. We go to number 8. Thank you, Colin. You passed. That was a test. I knew that. I was just testing you. All right.
I'm going to do number 8, which is a report back.
Yes,
During the budget workshop, supervisors asked for a report back presenting the current data on progress being made with hiring and other issues related to ESA. You have a transmittal which shows that we're having significant improvement in our turnaround from requisition to just to providing candidates to the departments. Remember that hiring is a complex process which requires testing for most classifications and forming a list. So this shows that within 90 days, 90% of the turnaround that's required by the ESA department is done on a yearly basis. And then you have it split out on the next page showing quarterly progress. Classification studies turnaround are also improving, so that we had 700 classification studies that were done in the last 4 years, and we're keeping track of all of them in our new database and case management system, so that hiring managers can keep track of online of what's going on with their classification study as well as their recruitment. Then we also included some information from the employees or customer satisfaction survey, which was surveying the departments. You can see on the graph that there's improvement that's significant. And that has to do, I think, mainly with the fact that we're focusing HR analysts on specific departments. So it's no longer a general purpose job. For the most part, it's focused on particular department needs so they can develop particular understanding of the department and relationships with the hiring managers in those departments. You can also see the information about our employee exit surveys. So with that, I'll ask for any questions.
Thank you. Do we have any questions of Dr. Smith? Supervisor Chavez?
Yes, I wanted to just say thank you to the staff for putting this graph together and putting the report together. And one thing that I would recommend, and perhaps this happens in FGOC or a committee, but I do think looking at the dashboard that the staff has created, it's interactive and something that our staff has access to, that they can look at the progress in hiring. I think is just worth the board getting a chance to look at. One request I wanted to make is that I think it would be helpful if the staff could do 2 different types of surveys, because right now, one survey is you have to say who you are, where you work, and who you're mad at the ESA. And I think we should do one that's anonymous to just create a little more freedom for people to give feedback to the process. And Dr. Smith, is that something that you all could incorporate in your satisfaction surveys?
Yeah, we're intending to do that. The original intent was to make sure that we could act upon any complaints or deficiencies, but we decided to also add another survey that would be completely anonymous so that we could get a feeling of what people would say if they knew it was anonymous.
Right. And then maybe interweaving them so that there's a little more rapid response. But I think this is a dramatic improvement. I know there's more to go. And I know that we're just bringing more people on, but I really appreciate the information in the packet. Thank you.
Thank you.
Okay, and this was a received report only. Dr. Smith, thank you for that. What I'm going to do now is make a motion to move items 9 through 42, except items 25 and 26, which have already been heard, to move 9 through 42 forward to the June 16th for final approval, except for any items that supervisors would like to hear. And I would look for a second, and then I'll turn to Supervisor Simidian.
Supervisor Wasserman, did you mean 9 through 41 rather than 42, which is not a budget item, if I'm reading my packet correctly?
I have 42, correct, it's not. It's approval of an assembly bill regarding VTA. Thank you. Yes, sir. 9 to 41 is my motion. And then I have a list with each of your names on it. And I'm happy to take whichever items you wish to hear, but I need a second first to proceed.
Second.
Vice President Ellenberg, I see your second. Thank you very much. She just beat you, Supervisor Chavez.
No problem.
Supervisor Simidian, your hand is still raised. Would you like me to start with you? Your hand is down. Vice President Ellenberg, do you have any items 9 through 41, excluding 25 and 26, that you need to hear? You do not. Thank you very much. Supervisor Simidian.
I just have a brief comment on item number 17. If this is the time, I'll just make my brief comment.
Please make your comment.
On item 17S, I am happy to support the item. This is with respect to capital support for some of our EANs, our Emergency Assistant Network. I just want to indicate that I think we set a bit of a precedent here, and that's okay, because we'll have others that come back later and say, we weren't in the queue at budget time, but now that we have our plan squared away, we'd like to be in the queue. And just want to underscore the fact that my expectation is that we'll provide similar review, scrutiny, and then support. Thank you.
Thank you for the support on 17 and no other items needing to be heard. Supervisor Chavez, do you have any items you wish to hear?
Yes, I'm and maybe at 37 and 38, and just to highlight this for my colleagues, what I'm interested in is medical detox, and I don't believe it was in there, so just to alert staff, that's why I'm pulling it.
Okay,
And then otherwise, I'm comfortable with the rest being on consent.
thank you very much. Supervisor Lee.
Yes, I have like to pull item number 32. As for item number 9, I'm okay with it. I just want to speak on it if I can.
Please, let's start with item number 9, then we'll do 32, then 37, 38 in numerical order. Anyone wishing to speak on item number 9, please, from the public, please register electronically. Supervisor, well, I can't actually say that. Anyone wishing to speak on any of the other items that we're going to handle in one motion, please register electronically at this time. Supervisor Lee, item number 32.
Okay, you want to do 32 first? Okay, all right, 1 second. Voila. Yes, 32 is regarding the revised recommendations for the VMC hospitals and clinics. The Race and Health Disparities Community Board has been doing great work. However, in order to complete their work plan, they need funding to engage a consultant to support them in their work. During the Health and Hospital Committee meeting on April 27th, I have requested funds to support the work of the Health Disparities Board. At that meeting, I've asked staff to confirm that the funds requested by the Health Disparities Board to execute the work plan could be supported in the budget. At the time, Dr. Smith mentioned that the staff would work to include it in the revised recommendation for June, and that if it wasn't in the June budget, that the administration would consider doing it a stepwise manner throughout the year. We did not see this funding reflected in the June revision, and would like to confirm if this is still the administration's intent to fulfill this funding request in the coming fiscal year, perhaps in the phased approach suggested by Dr. Smith.
Thank you. Dr. Smith.
Yes, that's still our intent. While I have the floor, can I
Yes.
comment on Supervisor Chavez's question about 37? The substance abuse beds are referred to in 37A. It's more than $1.5 million, which we were thinking it would be. It's 1.8. So that's the substance abuse beds for Pathway.
Thank you. Supervisor Lee, did that
Okay,
conclude?
so I would like to ask that the funding updates, as I requested earlier, for the Health Disparity Board to be chair of the Health and Hospital Committee in the future. Thank you.
Thank you. We have that in there. We now move to item number 37. Supervisor Chavez.
Thank you, Dr. Smith. Those beds I understand are community beds. What I was asking about was medical detox in the hospitals, our county hospitals. And so are we looking at medical detox in the county hospitals expanding over the summer?
Dr. Smith.
I'm sorry, I was misunderstanding your question before. Inpatient detox, we do on a case-by-case basis. The hospital staff is developing a plan for when we need to have admissions. Basically, it's not somebody who's merely intoxicated, but also someone who has a medical condition like hypertension or some other significant medical problem, typically related to the substance abuse. So yes, we're working on making sure we have effective and useful protocols.
So Dr. Smith, when we have this discussion in August, could we just pull that out? Because I do recognize the point you're raising is that we're doing medical detox now. And my understanding is exactly what you just said, that we're doing it when there's a co-occurring, something co-occurring, but I don't know what the capacity is for us to accept someone who needs medical detox, who's openly interested in medical detox, that maybe have a higher risk in terms of the process for them getting into the hospital system versus pathway, or versus not getting into a system, because we don't formally offer medical detox in our hospitals. So that if we could just get to the bottom of that would be really helpful. I think then we would stop talking past each other on the topic.
Sure, we'll get it all to the committee and make sure the algorithm is clear.
Yeah, and if we could, I think if the whole board's discussing our expansion of behavioral health services, if we can add it to that August discussion would be great.
Oh, okay, sure.
Yeah, thank you.
Thank you, Supervisor Chavez. So with that, you're on board for 37?
Yes, and 38. I think they can be moved together. They're in two pieces. So I wanted to make sure I didn't miss them.
Thank you. 37 and 38. Supervisors, that was it as far as the items 9 through 41, excluding 25 and 26. We have no members of the public wishing to speak on any of those 30-odd items. So I'm going to ask Colin for a roll call vote.
Oh, Supervisor Wasserman, sorry, I have some comments on 9, please.
Oh, I'm sorry. I didn't write down 9. I apologize, Supervisor Lee.
No worries.
That's why you wondered when we started at 32 when I said numerical order. All right,
Yes.
number 9, go ahead.
Thank you. So regarding the funding of ARPA, as of today, we've spent about $360 million in COVID-19 expenditures on payroll. The board has allocated $78.5 million in year 2 of ARPA funding for ongoing COVID response, which is mostly expenses not covered by the FEMA reimbursement. If the administration is looking to draw down another $12 million from the ARPA funding, which bucket of ARPA funding in the allocation plan will then receive less funding?
Doctor? Greg?
Yeah, I can speak to that. Yeah,
Please.
sure.
Uh-huh.
Yeah, at this point, this is still part of that estimated bucket of costs that would be needed to reimburse, direct pandemic response costs.
Right.
The other buckets that were identified by the board in late 2021, I know were based on a number of estimates for some of those costs, and I know staff are working on the actual implementation of a lot of those buckets. And when we come back, we'll get updated estimates. If at some point we identify that there's not enough ARPA for everything was identified by the board as a priority for use of ARPA, then we would want to come back to the board and ask for some kind of supplemental funding if the board's still interested in carrying all those out. So the intent is to still do everything within the bottom line, recognizing that there are estimates for each of the buckets, if I could continue to use that term, knowing that in the end, when it all starts coming together, if there's not enough little savings in one place to help out with another one, we'll have to have that broader conversation with the board about where and how to supplement. Right now, the desire and the intent is try to accomplish each of those intents and purposes.
Okay. Yeah. So since we also haven't seen the latest ARPA allocation plan for a while, I would like to request off agenda report with information about the expenditures to date for each of the programs in this allocation plan, or at least request that the allocation plan expenditures be added to the COVID cost tracking dashboard. Is that doable?
Yeah, we can do that.
Okay, thank you, Greg. Appreciate it. That's all I have.
Thank you. All right, I see no other hands raised by supervisors or speakers. And if I haven't forgotten another one, Supervisor Lee, let's call for a roll call vote.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Colin, now we move on to the last and final one that Supervisor Simidian pointed out, Jackie Robinson's number 42. Do you agree?
Yes, item 42.
All right. One day a year, Supervisor Chavez, all Major League Baseball players wear number 42. All
I'm
right.
going to say that at home at dinner later.
There you go. All right, item number 42 is to approve an opposed position on Assembly Bill 2181 relating to a revision of the membership Santa Clara VTA Board of Directors. And I've got, do we have Steve Preminger on this actually? That's who I've got in my notes.
No, we don't need a staff recommendation. I don't think the bill envisions a significant restructuring of VTA Board of Directors, which would disadvantage the County Board of Supervisors dramatically by taking supervisors off of the board and replacing them with staff recommendation or public representatives, but increasing the number of representatives that the city has. So we're recommending opposing the current language and asking for revision, and probably Supervisor Chavez can give you a much more authoritative response than I can.
Thank you. Supervisor Chavez.
Thank you. I asked for this to be heard by the Board of Supervisors, as we are one of the impacted parties to this bill. So I am supportive of taking an opposed position on Assembly Bill 2181 put forward by Assemblymember Berman. Just a couple of issues that I want to raise, colleagues. One is that, you know, Assemblymember Berman did reach out to a number of us to get our feedback on the bill. However, the final text that was presented wasn't presented until early May, which didn't give us much time to work with Assemblymember Berman on the bill. Mayor Liccardo and I sent a letter to Assemblymember Berman making some recommended changes that we thought would make the bill stronger and still productive for the county and the residents here. After meeting with him, he was unwilling to make any further changes to the bill. The VTA benefits from elected officials being on the board, and they provide an important nexus, I know you all know this, to land use decisions, transit, and transportation decisions. Elected officials obviously are accountable to our communities, and even if you like the idea of not having non-elected officials mixed into the board, we did not have enough time to actually work through the impacts of these changes and better understanding those. And let me just give you some examples. Both county supervisors and other elected officials are critical connectors between MTC and Caltrain because we serve on those boards, and those boards make decisions about what resources come to the county. By the way, when I say county, I mean all the cities in the county. So that was an issue that I raised that he was unswayed by. And then the other thing is that as a region, we've effectively lobbied and acted together for grants and funding opportunities at a regional and state level. So the other thing I would just say is that VTA is about to embark on an internal cultural assessment to improve processing around working relationships between management and its employees. This is really sensitive work. And what I recommended to Assemblymember Berman is that as we get through the cultural changes in the organization, that we overlap the discussion about governance and not do it the other way around, as I think this is a very delicate time for VTA. The other thing is that he was concerned about us having alternate board members. The reason we have alternate board members is it's a great way to train new board members. It's very complex. And if you don't serve on the PAC and then you serve on the board, no matter if you have 5 elected officials or 15, it impacts the ability to learn about these really important programs. The other thing is the selection process. If you haven't read the bill, read it. It's very confusing, and I don't know that it makes it easier or clearer or better for all of us. So, and then the other thing is I would just say, colleagues, is that prior to the VTA tragedy, we had made a number of changes to improve the board onboarding, transparency, and a number of other changes that I don't think we've seen work out through the process because obviously there's been a lot interrupted. The VTA board voted unanimously to oppose the bill. The building trades are opposing the bill. The city of Sunnyvale, the city of Mountain View, the city of Morgan Hill, and the city of Los Gatos are all opposing the bill. 3 other cities are hearing this issue: Campbell, San Jose, and Milpitas. And we've received individual letters from Sunnyvale Councilmember Glenn Hendricks, San Jose Mayor Sam Liccardo, Palo Alto Council members Pat Burt and Lydia Koo, Mountain View Council member Margaret Abekoga, Morgan Hill Mayor Rich Constantine, Los Altos Hills Council member Stanley Mock, Los Altos Council member Lynette Lee Ang, and Cupertino Council members Kitty Moore and Mayor Darcy Paul. Colleagues, I would ask for an opposed position. I'm open to working with Assemblymember Berman in the coming years as we finish the cultural work, but I think this is the wrong solution to a problem that he's identified.
Thank you. So that was your motion?
So moved.
Thank you very much. Do I have a second? Then I'll recognize Supervisor Simitian.
I'll second.
Awesome. Thank you. Supervisor Lee got the second on that one. Supervisor Simitian.
Thanks. I can't support the motion. I will be a no vote unless we move to table indefinitely. I think what hasn't been said and should be said, colleagues, is look, a lot of good folks on the VTA board, a lot of good folks on their staff, but saying we're going to sort this out next week, next month, next year, I think is not persuasive, given the fact that this is now a problem that's been well documented for at least 20 years. Supervisor Wasserman and colleagues, I'm looking at language from the 2003-2004 Santa Clara County Civil Grand Jury expressing its concern. They weighed in again in 2008, 2009, and then again in 2018 and 2019. So we have 3 very different groups of folks over the course of 20 years, 3 civil grand juries. The first report back in 2003-04 said the grand jury inquiry discovered that the board, VTA, while composed of dedicated public servants, is not functioning well as the governing body for VTA. It is too large, too political, too dependent on staff, too inexperienced in some cases, and too removed from the financial and operational performances of VTA. The board is too large, too transient, and too occupied with other duties to provide direction and effective oversight to the staff in running VTA. The VTA board is currently constituted of appointed members from elected bodies in the county, does not provide direct voter representation on transportation issues, makes accountability remote, provides for conflicts and responsibilities, and overextends board members performing both their elected and appointed responsibilities. All of that language is direct quotes from almost 20 years ago now, 2003-04 at the civil grand jury. Years go by, and in 2008-09, Santa Clara County Civil Grand Jury report says, quote, recent events demonstrate that there remains a lack of responsiveness and accountability to the public. Existing policies and procedures have been corrupted, circumvented, or otherwise rendered ineffective. VTA has failed time and again to encourage dialogue, has obscured facts, and occasionally even stifled debate. The more one learns about how VTA executes its mission, the lower the confidence level in the board's ability to manage the agency. The board tolerates behaviors that do not encourage informed public debate about transportation and transit issues facing the county. VTA staff develops plans internally with little or no public or board input at the early stages. Information relevant to these plans is carefully controlled. The board has taken a passive role, allowing VTA staff to control the board, the Citizens Advisory Committee, Citizens Watchdog Committee, other advisory committees, and the public at large to minimize any influence or change of its internally developed ideas. It is critical, says the civil grand jury, still quoting, that citizens of Santa Clara County reach an informed consensus on transportation and transit policy. These are issues upon which reasonable minds can and do disagree. Free and open debate is essential to reaching a consensus. The VTA has, however, failed time and again to encourage such debate. To the contrary, VTA has obscured the facts and occasionally even stifled debate. These are not my conclusions, colleagues. These are from the civil grand jury, not once, but twice. Third time, just in 2018 and 2019, again, quoting from the report, the grand jury concluded that today, More so than in 2004 or 2009, the VTA is in need of structural change to enable it to better protect the interests of the county's taxpayers and address the many complex challenges presented by emerging trends in transportation, rapidly evolving technology, and the changing needs of Silicon Valley residents. I'm going to skip a little in light of the hour, but it goes on to say, if VTA is going to meet the many challenges it faces, the VTA board will have to make good on its commitment to radical change. So the question becomes, is the board, the VTA board, capable of making the policy decisions and providing the strategic oversight necessary to accomplish such change? The grand jury has concluded that as presently structured and operated, that level of capability does not appear to be present. That's 1, 2, 3 different grand juries over the course of 20 years. And Supervisor Berman, here's one place where we can agree, Mr. Chairman. I don't think he's landed on the right formula. I don't think even, Assemblymember Berman, rather, I should have said,
Sure.
Assemblymember Berman hasn't yet landed on the right formula. But if the bill dies, then there is no further opportunity for conversation about the bill. And we go through another 2 years of exercise where people are frankly not stepping up to the challenge of restructuring the organization. Now, I say all this in a somewhat more informed way. I've only served on BTA for a year, but it was a very telling and trying year in this past year, 2022. And as Supervisor Chavez alluded to, there are clearly labor management issues. There was a absence of a CEO when I arrived, on an absence of a CFO. There was the compromise of the data system by folks who pursued a ransomware scheme. There was the kerfuffle around Measure B funds that were initially not allocated to programs as promised in something called a scenario. There is the concern about cost overruns on BART to San Jose. I would rather that we simply table the item. And, so I'm going to say I move to table. And if we end up voting to oppose the bill, then it's a vote, frankly, in favor of a status quo that I don't think is supportable. So I'll move to table the item indefinitely. If we want to bring it back after further negotiations sometime in the fall, we can. But for now, I think supporting the status quo, given that 20-year history, is hard to countenance. Only other comment, Mr. Chair, is I think it's important to note that a number of cities have said they oppose unless amended, but if the bill dies, it can't be amended. And I'm looking at a letter with folks from half a dozen different cities, including Cupertino, Palo Alto, Los Altos Hills, Mountain View, Gilroy, who have indicated that many of them former VTA members, that they support the bill in concept, which is where I personally am, support it in concept, not as currently written. So again, I'm going to move to continue the item indefinitely rather than put a stake in the heart of a well-intentioned reform effort, which is not yet complete.
Okay, that's your motion. We have a motion and a second by Chavez and Lee. I sit on the VTA PAC as representative for the county. I voted previously to oppose this bill. I do not like the idea at all of not having 2 county supervisors on it, and the PAC was unanimous in its opposition as well. With that said, is there a second for Supervisor Simitian's motion? Hearing none, we'll go back to Supervisor Chavez and Lee's motion. Any additional comments? Supervisor Chavez, and we have for the record, we have no members of the public wishing to speak. Supervisor Chavez, I'll just say what I was going to say, and then I'll go to recognize your hand raised. I do want to oppose it, which means a yes to the approved recommendation or your motion. I do think opposing unless amended is an interesting venue to take. And now I'll recognize you with your hand raised. Supervisor Chavez.
Yes, thank you. The reason that I'm recommending an oppose without an oppose to amend is that from speaking to Assemblymember Berman, he was not interested in any amendments to the bill. And the other issue I would just raise, Supervisor Simidian, is that the bill has come out of the Assembly and is now going to Senate Transportation Committee. And so there isn't really much time to amend the bill, and we're so far apart on what the challenges are with the bill that we were unable to come to a conclusion. So I'm really asking for an opposed period, because we did try to get some openness to an amendment. And then the second point I wanted to raise is that I concur with Supervisor Simidian's point that absolutely there needs to continue to be evolution and change. This bill is so far from the place I think we need to be that a number of the issues that the grand jury report raises, I do not believe are remedied by this new structure. And so I think we do have to go back to the drawing board, and we didn't have much time because we weren't availed of the text amendments until early May, which is why I do think we need to take the time this next year. But I agree that change is necessary, but this is way too far off the bench. I mean, off the mark for me to support.
Supervisor Simidian, your hand is raised.
No, I've said my piece. Thank you.
Okay, thank you. I too am not pleased with the 20-year history, as Supervisor Simidian just articulated. At one point when I was working, I guess it was on the PAC, it was reported we had the lowest fare box recovery in the nation. So I think there's significant changes need to take place, and I think elected representatives doing that. I hope if this is defeated, that causes a reform that meets the satisfactions of Supervisor Simidian and Chavez. Saying that, with no other hands raised, I'll ask for a roll call vote. Please, Colin.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
No.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
4-1. Thank you.
Thank you. I believe, Colin, that concludes our agenda.
That is correct.
Okay, and with that, we are, I believe, recessing. Is that correct, James, to tomorrow's meeting? Or is this adjourned?
Recess.
Thank you. We'll recess and we'll continue in our chronological order. See you all tomorrow. Thank you. Have a good evening.
Recording stopped.
Thank you all for attending. With that, this meeting room will be closed.